Sandra all the time is here with a cold heart true. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. We always calling Sandra. And when they start fighting, we calling Sandra.
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. All right. Good morning. Good morning. Good morning. Happy Tuesday, everyone. How's everybody doing this beautiful Tuesday morning? Let's get the show on the road. I hope everyone had a fantastic evening. We're going to go ahead and go live on Instagram. There we go. We've clicked on that little button, and then we'll share the links with everyone. Very, very interesting discussion scheduled for you guys today. This is one of those topics that, I'm going to tell you, week on week here on Medical Rundown Tuesdays, Health City really brings some very informative discussions to the forefront. So this is yet another one that I personally am looking forward to. You don't really hear people talking about this. So let's go ahead and bring in Mr. Shamari Scott, who's the Chief Business Officer at Health City Cayman Islands. Good morning, Mr. Shamari. How are you?
Good morning, Sandy. How are you doing today?
I'm good. So
and I have a new computer, and
Oh,
not my IT team's fault, all my fault. I was supposed to take it for them to fix the driver or something in order to get
oh,
the
no
camera to
worries.
work. So you won't be seeing me today, but you'll definitely be hearing me.
Okay.
How have you been?
Yes, been very, very good. We're rolling into the last 2 weeks of the election now, so I'm
So you're
I'm
busy.
ready. I'm ready.
All
Woo,
right.
I've had enough.
Unbelievable. All
So
right. There we
you
go.
you guys on Tuesday give us a much welcome break.
There we go.
Have a nice educational discussion on all things related to health. So I know our focus today is going to be
That's
health,
right.
oral head and neck
Next
cancer
cancer.
awareness.
Yep. And once again, pleased to have such a great professional that's going to be on with us, Dr. Ravneet Verma.
Hmm.
He is our ENT consultant, has over a decade of experience, and that experience actually extends to endoscopic sinus and skull-based surgeries,
Hmm.
hearing reconstruction surgeries, head and neck tumors, as well as vertigo and voice and
Hmm.
sleep disorders as well. And we're pleased to have him both with us, obviously, at Health City, but also to be able to get him on the show so that we can speak about raising awareness for oral head and neck cancers, as you mentioned.
Hmm. All right. Well, Dr. Ravneet, can we just call you that if that's okay? Good morning.
Yeah, that's perfect. Good morning, Sandy. Good morning, Shamari. Uh,
Yes, nice to have you here.
Pleasure being here.
So we know that Health City Cayman Islands really goes out of their way to find the best of the best, and having them here on the program to answer questions and bring these very very important topics to the forefront for listeners to learn. So I'm interested in your expertise because one of the things he mentioned, vertigo. Now I know that isn't today's discussion, but I'm hoping one day that we can talk about that a little bit. Can you tell us how much experience you've got with that? Because I've got friends who deal with that, and yeah, they haven't found the answers quite yet.
Yeah, so balance is actually, ears are one of the most important organs for balance. And
Hmm.
almost half of all vertigo patients are actually suffering from ear disorders or ear related balance problems. And so that's where an ENT comes in. The most common cause of vertigo is actually called as benign positional paroxysmal vertigo, in which there are calcium crystals in the ear that get displaced and they can actually be fixed on the spot. You don't have to get, a lot of investigations done, a lot of medication to be taken. It's just some repositioning exercises, and that's it. So that's one of the most common ones. Infections in the ear are another big issue with vertigo, so those can be taken care of. Of course, there are neurological issues that the neurologists take care of, but at least half or more than half of all vertigo patients actually end up with the ENT.
Hmm. Amazing. Wow. All right. So today we're talking about oral head and neck cancer awareness. And by the way, I know the person that question is for is listening. She's always listening. So undoubtedly, she'll be reaching out to you here shortly. But this topic is also very, very important. And of course, one of the fantastic things that Health City always does is anytime there's like an awareness month or an awareness day, they bring these sort of additional topics to the forefront, which I think is very very critical. So we're going to just pull up the slides here this morning and talk about this, because what percentage of the population, and I know it's actually a growing percentage, but what
Yeah.
percentage of the population has to deal with oral head and neck cancers? Like, we don't even think that much about it, to be honest.
Yeah, it's so on the list of the most common cancers. It range according to different statistical analysis. It ranges somewhere from probably the fifth most common to the eighth most common. So probably not as much talked about as it
Mhm.
should be. But as a population, about 2 to 4% of the population, depending on which part of the world you're from. But
Mhm.
considering 2 to 4% of the whole population is a big of the whole of all cancers is also a big number.
Mm. Absolutely interesting. So, obviously, since this it's recognized every single April, this is an opportunity now to increase public understanding of these cancers, which often go undetected until really advanced stages. So, education, early detection, and lifestyle changes to reduce the risk is one of the recurring themes over and over again with all sorts of health issues. And this is what I love about Health City. They're not just here to say, oh, come to us, we're going to fix it with surgery, whatever. They're like, no, let's educate the people of the Cayman Islands, look for early detection, lifestyle changes to even reduce your risk of ever being impacted by these cancers, so that hopefully that's one less thing that you ever have to see a physician about. So I think that that's extremely important. And of course, if you are in a high risk category, to encourage routine screening, which also is critical. So I didn't even have to ask the question about one of the major contributing factors to this would definitely be smoking. Anything tobacco related, not just smoking, but anything related to tobacco use. So affecting the mouth, the throat, the voice box, the larynx, nose, and sinuses. So we see that there's so many things that smoking impacts, and this is yet another one. But people have to be cognizant. Let's talk about this, Doc, of it's not just smoking, but it's smokeless tobacco as well, and alcohol consumption.
So with head and neck cancers, actually, one of the most interesting facts is that it's one of the most preventable cancers. Smoking and alcohol actually increase your risk by up to 60%. Smoking alone can increase the risk by 60%. So if you take that big chunk out, you're left with fewer numbers. And then alcohol, again, another 20 to 40% increase. And the fact that both alcohol and smoking combined, they just don't have an additive effect, they have a multiplicative effect. So if one increases your risk 3 times, the other increases your risk 2 times, it's actually not 5, but 6 times risk. So avoiding both is really, really important. And as I said, you can take out a major chunk just by changing your lifestyle, stopping tobacco and alcohol. It's not just about reducing it, stopping it. And once you stop alcohol and tobacco use, it takes a while for the effects to reverse, but you can actually bring that risk down to almost zero just by stopping it. And over time, the body repairs itself, because both these substances, they actually cause recurring damage, and that's where your cancer starts developing. So with smoking, even with the chewing tobacco, with smoking you'll have more of larynx cancers. With chewing tobacco, you'll have there's an increased risk of lip cancers, oral cavity cancers, and so according to the area that they're most in contact with, and that tells us that these are causing it, because if you put chewing tobacco under the lip, it's causing lip cancer. It's a very direct correlation there.
Wow. Let me just break down something you just said, because I think you said something extremely important. And if people were not paying attention, they may have missed it. So you said it's not just when you're using alcohol and tobacco, it's not just about an increase effect, it's a multiplier. Tell us what you mean by that. Let's break that down so that everyone has an understanding of what that means.
All right. So let's say if you smoke, the chances or the risk of getting cancer is 3 times. And if I say, let's say you're having tobacco, and the chances of getting cancer is twice. So if somebody has both exposures, let's say tobacco and alcohol, the chances of getting cancer would not be just 3 plus 2, it would be 3 multiplied by 2. So you get a 6-time increase in cancer and not a 5-time.
Wow. Okay, I got you now. All right. So, there's been a lot of, I think most of us know how bad smoking is. I don't think there's, you won't find too many people in the population anymore that think that smoking is a good idea or that it doesn't have severe health risk. But there's a growing body of evidence and information around alcohol use.
Yes.
And now the sort of medical advice is there's no such thing as a safe amount of alcohol. And that's a tough message, Doc. I mean, for me, I don't drink, so, it's okay. But I can tell you, for the average person, They're like, where did this come out from? I thought 1 glass a day was good. And, I'm trying to drink wine because that's good for my heart. And there's been all of this misinformation. No doubt, probably some of it, pushed out there by the alcohol industry. But there's been a lot of misinformation and sometimes not misinformation. We just didn't have enough information at the time to advise people any differently when it came to alcohol use. Now we know. It's undisputable that there's no such thing as a safe amount of alcohol. Yes. What do you say to people who are listening to me right now and thinking that Sandy's crazy? They're thinking, I always knew she was crazy. Now she's crazy. I'm going to continue to have my 1 glass of wine a day. Tell us what the medical evidence is saying.
Yeah, so you're absolutely right. There is no safe amount of alcohol. It is not protecting you from anything at all. I'm not going to sit here and lecture people to just stop drinking tonight. But what I do want to give the message across is, yes, alcohol will increase, and especially with alcohol, not just the risk of oral cancers, liver disease, gastric cancers. It increases all sorts of cancers. Like even with smoking, you can have a urinary bladder cancer with increased risk of that with smoking as well. But talking about alcohol, yes, there's no safe amount of anything. Some people are genetically more incline, or they have genetic risk factors as well. Those people, yes, would be more inclined to getting all of these diseases with the substance abuse. Abuse is bad, yes. But if we have definitive conclusions right now that one, it is not protecting you from anything, definitely. And the smallest quantities also increase your risk. The increase in risk may be small, but there is an increase in risk. There is no safe limit for alcohol, tobacco, or any of these substances.
Yeah. Okay. All right. So HPV infection. This is one that many, many years ago, I'm a fan of NPR. They have a lot of wonderful educational programs. And oh gosh, this is probably maybe 15 years ago or even more. I was driving along in Miami and I heard this amazing show on the radio. And they were talking about, they saw an increase. There was an increase in oral cancers of the mouth and so on, and of the neck. Same thing we're talking about here today. And they started to research, why has it jumped? What is really going on here? And so this next thing, which is an HPV infection, being associated with head and neck and mouth cancers. So tell us a little bit about that. What is HPV infection and how is it associated?
Yeah, so HPV is a virus. It has a number of subtypes of the virus. So the one associated closely with head and neck cancers is HPV type 16. The most recent significant uptick in cancer incidence, especially in the oropharynx, which is around the tonsil area, the back of the tongue, all of those have actually been attributed to increase in HPV related cancers rather than with other stuff. Because as we know, smoking was cool maybe 30, 40 years ago. It's not anymore. So there's not an increase in other risk factors, but with HPV. Again, a very preventable cancer. HPV vaccines are easily available, can be taken. A lot of times people think, oh, I don't need to. So there are risk factors associated with who would be more at risk of HPV related ones as well. So sexual activity, having a safe sexual partner and all of that is important here. One of the most important factors, HPV can be found in a large segment of the population, which will not, again, put them at risk of just getting cancer because it's very highly prevalent. But there has been a recent increase in HPV related oropharyngeal cancers. And so there are other risk factors associated with it as well. That, with smoking and alcohol, you're increasing that risk. If you have high risk behavior, is how we put it. You're increasing your risk of cancer. While HPV is common subtypes, and so the exposure is quite common to get, but you can get the vaccination, reduce that exposure, prevent this cancer even in these subtypes.
And of course, now that we have an HPV vaccine that is available, I think over the coming decades that maybe we'll see a reduction perhaps from that particular cause, because now we know that the HPV vaccine is highly effective at preventing certain types of HPV that are associated and linked to, different types of cancers. So some hope there that medicine and advances in medicine and vaccination is something that can be extremely helpful. So, of course, with all illnesses, early detection is most important. Early stage cancers are oftentimes treatable, and you can get ahead of the diagnosis as quickly as possible. Now, how easy is it, though, because some cancers are easier to detect at an early stage than others, but when it comes to these particular types, oral, head, and neck cancers, how easy is it to actually see early signs?
So a lot of times, yes, it may be difficult because you get an ulcer in the mouth. People think, oh, it's nothing, it's just an ulcer.
Mhm.
People get ulcers all the time, but you have to recognize that the ulcer doesn't go away in a few days or maybe even a couple of weeks. You have to get it checked out. A small white lesion in the oral cavity, you're not sometimes just going to keep looking in your oral cavity, behind your cheeks, keep checking your mouth all the time. So it's very important that a regular checkup even with your dentist is really important here for prevention. Now, if you catch these cancers early stage, they have very good survival rates, even at all, considering all stages, all ages, all sexes, all including everything in the whole population. The 5-year survival for these cancers is more than 60%. Out of these, in more developed countries where oral care is taken care of, people go to their doctors regularly, get these checked out, the survival rates are much higher, while in the lesser developed countries it's much worse because they just go at a later stage. So it's also very important to get these dental checkups done, keep these things under care. The diagnosis is pretty simple because it's a very visible area, especially in the lip and the oral cavity, the tongue, the cheek area, tonsillar area. You can easily see these areas. So if there is a minor lesion, should not be ignored. Again, as I said, you cannot look into your mouth all the time yourself. So getting your dental checkup done, going to your ENT for any recurring problems, any minor issues. So a cancer of the nose or sinuses, bleeding from the nose, again, highly ignored. But if once or twice it can happen, but you need to get it checked out if it happens again and again. Now, cancers of the throat, any change, constant changes in voice, again, people ignore that. Any feeling of something stuck in the throat, even just sharp pain which in the ears, which is not going away, fullness in the ears, that can be a sign of nasopharyngeal cancer as well. So all of these symptoms are, yes, very subtle symptoms which can detect early stage cancers, and they need to be looked at.
Yes. And we see a list here of, some symptoms to look out for, a lot of which you just mentioned. I don't know if you've seen this, Doc, but I've seen a couple shocking stories where you'll have people, newscasters or people doing an interview, and someone is in the audience on TV is looking at them and they notice a lump in the larynx area or in the throat area. And then they reach out to them and say, you need to go have that checked out. And lo and behold, they observe something that was really, really critical, because it might have been, oh gosh, what's the other cancer that thyroid cancer and other things that the person, I guess they don't see it themselves. Maybe they're looking in the mirror every day, but they don't see this growth, and somebody else sees it and goes, whoa, what is that on your neck? You need to have that checked out. So sometimes other people around you might make an observation that you've not really paid attention to. So any sort of lumps or sores, as the doctor said, in the mouth that are not healing, voice changes, again, being very, very important, swelling or mass in the neck, unexplained weight loss even, white or red patches in the mouth, interesting, and a persistent sore throat can all be indications of something that you definitely need to have examined by a physician and checked out a bit further. So some very good points there. And of course, risk factors, we've already mentioned alcohol consumption and tobacco use. I don't know in this country that a lot of people are probably chewing tobacco, but nonetheless, still something to keep in mind. Let's talk about the one thing that a lot of people here will always argue with me about, and that is marijuana use. Smoking marijuana, they say, oh, that's good for me. It calms my nerves. It helps with my depression. Smoking a joint just relaxes me, but it is still smoking, right? So let's talk about that, which a lot of people try to shy away from. I think the general consensus is smoking anything can't be good for you. Is that right, Doc?
Yes. So imagine there's a fire burning. You're not going to go and put your mouth and inhale all of that smoke, right? So whatever you're burning, it is actually producing carbon material. It is producing all of that smoke and you are inhaling that. So yes, that does not take away. One thing might be more, worse than the other thing, but none of them are good for you in general, especially when we talk about head and neck cancers. I'm not going to talk about the advantages, disadvantages of, the medical use of marijuana here. But yes, smoking anything is very categorically increases the risk of cancer in the oral cavity, in the larynx, and actually in other parts. So lung involvement, the esophagus, various body parts.
Mm-hmm. Sun exposure. That's
Yes.
still playing a key role here. Prolonged sun exposure. So people who are still out there tanning, does that include tanning beds as well?
So any UV exposure, yes,
Mhm.
can. Now, the evidence regarding this is not as solid as those for the other ones we've talked about. But
Mhm.
yes, it makes sense that you have extremely high exposure to UV lights. Uh, you do see a higher rate of lip cancer in those who are more exposed to sunlight. So
Mhm.
yes, and with this you can the precautions are much simpler, right? Using making sure you're getting some protection for your lips from the sunlight, using some headgear, maybe just a simple hat would reduce all of these risks as well.
Mhm.
Sunblock can do that for you, and just taking simple precautions like that. Again, with the lip,
Mhm.
even uh, uh, the early detection is even simpler.
Mhm.
So again, those while I said the evidence is not that solid.
Mhm. All right, we do have a caller. Good morning, Denny.
Morning.
Morning. How are you?
I'm excellent.
Good.
Um, the I know people who smoke cigars,
Mm.
and they take comfort in the fact that they don't inhale it, the smoke.
Mm-mm.
Now, um, I think that's a really bad idea, but I'd like to hear what the doctor has to say. And there's one more thing that I want to pick up on that
Mhm.
the doctor referenced earlier, and
Mhm.
it was just a passing comment, but he said that that your body repairs itself over time after you stop smoking.
Mm.
But that has to be that conversation there that's an entirely separate conversation in and of itself,
Mhm.
because that is assumed that you're going to eat a proper diet with quality protein,
Mhm.
because the damage that you do to your body isn't going to be repaired unless you give your body the proper materials with which to do the repairs.
Mhm.
So that's an entirely separate conversation. But
Yeah.
the reason I bring it up is I don't want people to just think, oh, all I have to do is stop smoking and then everything will
Mm.
be okay. No, there's
Yes.
more that has to be done.
Yeah. Okay. Thanks, Danny. I appreciate that. So the first question is in relation to people who smoke cigars. Are
Yeah.
they any safer?
No,
Mm-hmm.
that's my answer there. I mean, no explanation required. No, they're not safer. And that's it. The amount of tobacco exposure in general, any way you take it, as we talk about various ways to take it, it just it depends on the amount of exposure. So if you smoke one cigar every day versus you smoke 10 cigars every day, it's just going to increase your risk tenfold. If you take one cigarette a day versus 10 cigarettes, it's just increasing your risk tenfold. It does not protect you. It is not going to be less cancer causing than anything else.
Yeah.
With regards to the question on the repair, that was, just to tell people, oh, I've been smoking for so many years.
Mhm.
What's the point of stopping now? That
Right.
was just to help people understand that, yes, even if you stop today, your cancer risk goes down eventually, not just leaving it for 5 days, but it
Mhm.
is a slow process. Most of the oral cancers, at least head and neck cancers, they develop in what is called as a pre-malignant lesion. Like we talked
Mhm.
about the red and white patches, they're called leukoplakia and erythroplakia. They're precancerous lesions where
Mhm.
cellular changes have started taking place. They just
Mhm.
haven't become cancerous yet. If
Mhm.
you stop exposures, those things can be reversed. Your pre-malignant lesions can come back to normal, reducing your risk of getting that cancer. So, and
Mhm.
the diet bit was very important here. Again, a good diet, a healthy diet, having vegetables, having a more balanced diet is also very important. Diet has been people who have an unhealthy diet, having
Mhm.
becoming overweight grossly, they also have been shown, again, one of the controversial risk factors, but some studies have shown an increase of risk of oral cancers, esophageal cancers with people who have unhealthy diets.
Mhm. Hmm. All right. Family history of cancer as well. So this is something that's another risk factor. And something that a lot of people don't think about is occupational exposure. So, those of you who work in certain types of occupations where you're exposed to chemicals, wood dust, and so on, even some artists, they might be using chemicals to produce their art. That is something that you need to think about. Now, here's something else I'm going to throw out there that might still be a little bit controversial and is continuing to be researched. But even the candles in your home, this is something that I am trying to get through my head as well. Burning candles in your home, burning incense, burning anything, you're taking that in. It's obviously not going to be the highest risk as some of the things listed here. But when you talk about reducing your risk, even the air fresheners that we plug in, again, are associated with all sorts of, respiratory issues and potential cancers as well. So you really want to do your best, folks, to think about the things that are in your environment that are contributing to your overall health and well-being. So I see a few people calling in on the WhatsApp. Let's see, Doc, if we can grab this WhatsApp call. Good morning, caller. Welcome to the program.
Hello, good morning, Miss Sandra.
Morning.
I am calling about some various situations that happening to me from I get to this island, right? But I'm
Okay.
gonna fast
Can we
so
we just have some
forward.
guests in the studio right now? Health Cities here. So if it's not directly related to them, can I just give you a call when their segment is finished?
But I need you to hear this on your program though.
Yeah, but did you hear what I said? I just have some guests in the
Yes,
studio.
I heard you.
Yeah, so I'll call you back.
Okay.
Okay, thanks. All right, folks. We got another caller. Good morning, caller. Welcome to the program.
Good morning, Sandy.
Morning, dear. How are you?
Good. Thank you for asking. A couple of things talking about chemicals. We have to take into consideration the use of a Roundup here on the island and how bad that is for you. And it's also possibly a cancer-causing chemical that's completely around the island. And also, we have to consider your doctor spoke on eating your vegetables. Well, yeah, you can eat your vegetables, but you have to understand the chemicals that are used also in vegetables. There's a lot of carcinogenics in the chemicals. So you just need to do your research and really know what you're buying and who you're buying from.
Yes, absolutely. Thank you so much for that. So just a reminder, folks, that, organic, non-pesticide vegetables are always going to be a healthier option for you when it comes to your diet. And a lot of times here in the Cayman Islands, purchasing from local farmers, again, being aware of how they're farming, you can ask them questions about their farming habits. And, I don't know if there's any local source of verifying what they tell you, but try to go for much healthier options if you can in terms of your diet, even skincare and makeup. You know, a lot of ladies are putting things, and when you think about it, your skin is actually your biggest organ in the body, and there's a lot, it offers a lot of protection, but we're also slathering a lot of stuff on our bodies. So, you know, trying to consider what parabens and other chemicals are in the things that we're putting on our faces and our makeup, and, you know, eye makeups and all sorts of stuff. Just yesterday, Doc, I was listening to something talk about emerging research about tattoos. And now there's a connection between tattoos and cancers. And, you know, the larger your tattoo is, the more likely there's going to be this association with cancers. So, folks, you know, there's a lot of information out there. Some of it is still developing. I know some people go, oh, they say something today, by tomorrow they're changing. It's not that. It's just that some of it, there might be an initial research that says, there's a link here, but we don't really know. It's not cause and effect, but something to keep an eye on. And then they continue to research and look into these things, and we get emerging information and data. And again, that's why we want to thank Health City Cayman Islands for coming on the program, because we get an opportunity to get the latest information from their experts and from their physicians. Good morning, caller. Welcome to the program.
Good morning.
Morning. How are you?
I'm okay.
Good.
I'm just calling. I don't want people to lose what the doctor is saying about the multiplicative effect of when you both drink and smoke, right?
Yes.
Because the doctor described it as, what was it? When you smoke, you increase your risk 2 times. If you drink 3 times, and then 2 times 3 is 6, right? All right. I'm sure people have heard things, you know, studies show that when you do this or you do that, your risk goes up by 33%. 2 times is 200%. 3 times is 300%. And when you multiply 200 and 300, you don't get 600. You get what, 60,000? So when you drink and smoke, you increase your risk of getting it 60,000%. Right? So kind of a bit pedantic, but just wanted to show that the number isn't just a little 1% or 2% increase. This is a large number the doctor is talking about. You do yourself a world of service by just avoiding drinking and smoking altogether.
Yeah. Okay. Thank you so much. Further explain the multiplier effect, which I think is important. But, you know, the interesting thing, Doc, about it is I've made the observation that a lot of people, like some people they're not regular smokers until they drink. So they do them together. So when you talk about this multiplier effect, it is very, very interesting, because you'll ask some people, oh, are you a smoker? They say, no, I don't smoke. But when they go out drinking, you'll see them taking what we call a hit, you know, off of somebody else's cigarette or somebody else's cigar. So in fact, the only time that they really smoke is when they're out drinking, or vice versa, you know? So a lot of people combine the two. I don't understand the psychology behind it, but it's like, well, one bad habit, the other one is, you know, just as easy, I guess, to pick up. But there you go.
Yeah, and that makes, you know, studying the effects of both these substances actually really difficult, because how do you compare somebody who has a packet a day versus a packet in 3 or 4 months, while somebody is having it, you know, there could be a person packet a day not drinking at all, another one just having, you know, a packet or 5 cigarettes at the weekend with drinks. So it makes these assessments really difficult as well. So for research to categorically come out and say, yes, this is the degree of association, it becomes difficult with that as well. But it is bad for you. So, I mean, the bottom line is, don't do it.
Yeah. All right. So early detection being the key here. You talked about routine dental checkups. Again, this is so important. But you know what? Also looking in your mouth. I mean, it's weird to say, but we brush our teeth, hopefully every day. Good oral hygiene is very, very important, folks. But, you know, we're brushing our teeth, we're flossing and doing all these other things. And then there's so many of us that simply don't look at what's happening in your mouth. It is surprising. You know, we're not really looking at our tongue. We're not, you know, not you have to do it every day, but just every once in a while, kind of get to know your body, get to know, because some of us, you might have spots and stuff in your mouth. Some of us have, fillings and different things that might discolor certain parts of it sort of naturally. So pay attention to what's happening in your mouth between your oral exams. But folks, make oral care also a part of your overall health care, because oral health is linked to a lot of things, including cancers and even heart disease and other things as well. So go to the dentist. I know nobody wants to hear that one, but so screening exams by your ENT. Oh, yes. If you're considered a high risk individuals. So the ENT will go a bit further, obviously, doc, than a dentist can, because that's a ear, nose, and throat specialist.
Yes. So again, with dentists, people do routinely go for a dental checkup, or should at least go for a routine dental checkup. And the dentists are actually pretty good at recognizing all of these early signs, the patches that we talked about in the mouth, under the lips, and they look in all of these areas because they're using all their instruments to look at their, teeth in all directions. So they look into all of these nooks and corners in the oral cavity, which otherwise even we don't routinely look into. But if you have to look deeper into the throat, into the nose, behind the nose, for what is called the nasopharynx, the tonsillar areas, the larynx, the upper part of the esophagus, all of these, and even for cancers of the thyroid, so you have any swellings, lymph nodes that have come up, these need to be checked by your ENT or a head and neck oncologist.
Mm-hmm. All right. Early diagnosis greatly improves treatment outcomes and survival rates. Of course, that really is the takeaway for getting ahead of it. And we have some ways in which you can be diagnosed. So there's, let's go through these, Doc. You've got the physical exam.
Yeah. So again, you're checking the oral cavity, that the mouth, especially the lip area, looking at the tongue, the tonsillar area, looking at the back of the throat, and then checking the neck for any lymph nodes, any swellings. There can be something as simple as a swelling under the jaw as well, and even in the lower part of the neck. So all of these areas are important to physically examine and look out for abnormal issues there.
Mm-hmm. All right.
And then using an endoscopy, again, there are two types of endoscopies that we do. One is a rigid endoscope that we can just put in the nose. It's a pretty straightforward examination. The other one is called a flexible endoscope. That's also can be done in the clinic as far as an ENT examination is concerned, where we can look into the nose, behind the palate, behind the tonsillar area, back of the tongue, the vocal cords, all of that area in the lower part of the throat, which is called the laryngopharynx. And it's a very comfortable examination, takes about 5 to 10 minutes. And that's it. I mean, it's pretty straightforward and can give you visualization of all of these areas which are at the back, which are not really accessible when we just open our mouth and try and look.
Mm-hmm.
And for any suspicious lesions, then comes the role of a biopsy. So if you, let's say, have a lymph node, a simpler biopsy option is a fine needle aspiration, where the pathologist or the surgeon would just put a small needle, take a small tissue sample, and send it for evaluation. If you see a lesion in the oral cavity, you can do a scrape biopsy, where they just scrape off a little bit of the tissue and send it for analysis. If you see a deeper ulcer, an incisional biopsy has to be done, where you have to cut into the tissue and take it out. And a lot of these biopsies, especially in the oral cavity area, can be done, as a daycare procedure under local anesthesia. So if you see something deeper in the throat, then yes, so it's a tonsillar lesion, then we have to take out the whole tonsil, because you can't ask the patient to undergo anesthesia twice, just once for the biopsy, second time for removal. So some of these would require what is called an excisional biopsy, where you just take out the whole thing and just send it for analysis. Other times you do a smaller biopsy, send a smaller piece of the tissue just for assessment, just to prove the cancer.
Mm-hmm. And then there's imaging things that are also available, CT scans, MRIs, PET scans.
Yes. recent advancements have actually made it a lot easier to diagnose and help us plan. So CT scans would give us more, access to certain bony lesions. MRIs are wonderful for soft tissue lesions. And PET scans are actually really, really important in cancer care because they tell us if the cancer has spread to any other regions and help us plan the correct modality of treatment for those patients, because we do have multiple modalities. Just these investigations not only help us in detecting the lesions, they also help us in trying to identify what type of lesion it could be, and also what is the extent of the lesion, so we can plan according to what the lesion is, how much the spread is. So it has to be the correct planning. Planning is really important. That's why we have tumor clinics as well, where we sit down, discuss all of these findings, and then come up with a plan that would be ideal for that particular patient. It's not one rule for all. It's each individual patient needs an individual plan for their for the type of cancer they have, for their age group, and for the risk factors that they have in their life.
Very good. All right. So going into the home stretch here, obviously, Health City Cayman Islands has an array of experts and physicians. I know you guys call them consultants, Shamari, but they're there and available to assist with both diagnosis and treatment options. So whether it's surgery, radiation therapy, or chemotherapy, let's talk about some of these, Doc, that are now available as well.
Yeah. So as a surgeon, I deal with removing tumors. So early stage tumors, very amenable to complete removals. Later stage tumors, or even sometimes the larynx. Let's say there's a small lesion on your vocal cords. It's proven to be cancerous. Sometimes radiation therapy can be the best treatment. So you don't actually have to remove any normal tissue. Your voice can remain as close to normal as possible. So again, even for certain different types of cancers, different stages of cancers, you could be using one modality or multiple modalities, where radiation and chemo usually go hand in hand. You sometimes give chemotherapy before radiation, sometimes after radiation, sometimes during radiation. And then you have targeted therapy, that's immunotherapy. That is the more recent therapy treatment option out of all of these. And again, we our medical oncologist goes through. So there is a targeted approach where you identify certain markers in the tumor, and if they are present, you can target those markers, and that has shown a lot of success over the past few years. And then post treatment, let's say cancer of the larynx, whether you've done surgery or radiation, whether it's more of a tonsillar area or anywhere to do with swallowing or speech, we have access to speech and swallowing therapy as well, helping patients not only just removing the cancer, but getting back to their normal self with a fully functional individual. We're not just removing cancers, we are treating patients here, and the post-op management of all of these symptoms is as important.
All right. Well, thank you so much. I mean, this has been very, very informative. Ooh, looks like we've got another question or comment. Good morning, caller. Welcome to the program.
Good morning. I want to say good morning to my good doctor. He's one of the best.
Oh, good morning.
Good morning.
This is the doctor that's working with you and your husband.
Yeah, he works
Yes.
in his ear, nose, and throat. I know him. I can see him in a few days.
Oh, wonderful.
Hi.
For me, I know him. He know if he hear the voice, he should know who it is. Oh yeah, one of the best that they got there.
Oh.
I see him a lot of times. I got to see him. I got appointment on the 22nd with him.
Okay, very good.
He's good and know what he's doing, and very kind and very nice, very nice, very, very nice.
Yes.
Down to earth. And very good.
Thank you so much, Ms. Shelman.
Morning, Dr. Renee. Morning to you. I'll see you in a few days.
See you soon.
All right. So someone giving you a little testimonial this morning. Dr. Ravneet, a big shout out.
Just made my day.
Fantastic. Well, thank you so much for coming on the program program. And again, this simply demonstrates that, these are cancers that do affect people in our community. And, it's good to have knowledgeable physicians available at our disposal, as well as someone who Michelle says is kind. That a lot of doctors, they may have the requisite knowledge, but they forget that part of that oath that they take, the kindness and the just the empathy that they can, practice medicine with is such a critical part of, just being a physician as well. Shamari?
Yeah, no. So glad to have Dr. Ravneet on with us today. And as you know, you couldn't see me, but I was here.
Yes.
And this is the great part about having Dr. Ravneet is I don't need to jump in at all because he's able to cover it from head to throat. I won't say head to toe. But just to mention that, here at Health City, because we have so many specialties all under one roof.
Yes.
The ENT specialty is one area that over many, many years, especially when we had international patients, when you're dealing with the cruise lines and otherwise, they would ask for the specialty, and a lot of times we would have to say, no, we don't have. So this was one of those areas that really helped to fulfill the entire offering. And especially when it comes from a cancer care perspective, that we want to cover the majority of areas. This is another area that's very special and unique that we're so happy to have Dr. Ravneet with us so that we can be able to cover the majority of areas and cover all gaps. And as you can tell, right, obviously we have a beautiful facility, but we all know that outside of a facility and outside of the latest equipment, and you heard from Dr. Ravneet, all of the various diagnostic equipment as well as services we offer, that's also important. But even more so important was you heard the patient calling in and speaking about Dr. Ravneet. And that's, the secret sauce, right, is obviously having the facility, obviously having the equipment, but the physicians as well as the nurses and everybody who is there from a human touch perspective. It's what's most important. And we're so happy to have Dr. Ravneet with us. And if you ever need to reach out, 640-4040 or info@healthcity.ky, and we'll be able to schedule a consult with Dr. Ravneet if needed.
Fantastic. Doc, any parting words for us before we let you go today? Thank you so much for coming on the program.
The pleasure's all mine. Thank you so much, Sandy, for having me. Just one last point on what you said. Sometimes you need empathy. I see one patient a week who just needs me to listen to them. Sometimes we forget. Most of the symptoms just go away. You talk to them for 15-20 minutes. You give them your time. You give them your attention. And after that, I could just write, salt and sugar for them, and they would feel better. So that's something that we should never forget. And just be attentive. Just listen to the patients. Listen to their problems. And sometimes you just get the answers. I don't need a CT scan. Sometimes just listening to the patient, finding out what their true issues are.
Right. All right. Well, thank you so much. We really appreciate that.
Pleasure. Thank you for having me.
All right, folks. So that's Dr. Ravneet Verma, who is the consultant ENT, Shamari Scott, and I can attest to the fact that he was present in class today, despite the fact that we could not see him, Chief Business Officer. And everybody else, we got 200 and almost 300 people between Instagram and all the other streams online, and countless more listening on the radio. Had a very, very interesting discussion this morning. Lots of information to take away. And folks, if you ever have any questions, because sometimes people will listen, they go, "Oh, Sandy, I have a follow-up question." I have someone right now asking about the maxillofacial surgery. Is that how we pronounce it?
Maxillofacial.
Yes. And they were asking about that. And, do you perform that type of surgery? I'm assuming maybe.
So depends on the extent of surgery. So definitive maxillofacial surgical expertise is with maxillofacial surgeons who go through the dentistry route. But if it's usually a team effort, if it's especially cancer related, So the reconstruction would be more maxillofacial, the removal would be more with us or the surgical oncology colleagues. Again, plastic surgeons sometimes get involved with them. They do a lot of the maxillofacial stuff as well. And we do have a plastic surgeon on board. So yeah, so if not a maxillofacial surgeon, a plastic surgeon, an ENT, an oncologist. So a lot of these people can get combined and take care of those issues.
Yeah, it just depends on exactly what form of treatment is required. Yeah, fantastic. All right, so thanks very, very much to our guests for joining us today. We certainly appreciate you both being here. Thank you so much. Shamari, have a beautiful day.
All right, thanks, Andy.
All righty, appreciate it. All right, folks, let's just take a little commercial break here and we'll be right back after these messages.
This is our home. These are our people. And the future we build together starts with leaders who care. Alric Lindsay has never stood on the sidelines. He's been in the heart of the community, working side by side with you. From financial reform to everyday issues that matter to families, Alric has always been part of the solution, not just promises but real progress. He fights for better opportunities, for economic fairness, for accountability, because Caymanians deserve more than words. We deserve results. In Georgetown South, Alric isn't just running for office. He's standing up for every voice that's gone unheard and every dream that's yet to be realized. Leadership with integrity. Commitment without compromise. A future that works for all of us. On Election Day, vote for the man already working for you. Vote Alric Lindsay for Georgetown South. For Cayman.
Hi, I'm Melrose Natasha Whitelock. Most of you will know me as Natasha. I have lived in the Red Bay area since I was 9 years old. I have raised my kids in this area. They all remain in this area. Over the years, we've realized that there's many things in our community which has been left undone, unchecked, simply ignored. This year, I've decided to put myself forward for you, my community, and my country, so that we can step up to the plate together and get our community and country back on track. On April 30th, please vote for me, Whitelock, Melrose Natasha, and Team TCCP.
I am Sabrina Teresa Turner, and I am running to represent the electoral district of Prospect. I've made the conscious decision to run with the other candidates of the TCCP because we are built on a foundation of honesty, integrity, and community first. Once you elect me on April 30th, I will continue the works that we have already started. Sustainable stormwater management, tackling with the traffic on Shamrock Road, and bringing our community and its people together, knowing that we are our biggest and greatest asset. Vote for Sabrina Teresa Turner on April 30th.
My name is Lauria Brenda Timothy, known to most people as Miss Brenda, and I am registered in West Bay North, and I'm proud to be registered in West Bay North to support Ralston Anglin. I've known Ralston all of his life, and better since he married my daughter, and he is an awesome dad to my 3 eldest granddaughters, Cheryl, Sharina, and Cherise. Well, I must say that Raleigh previously served as education minister, and I feel that he is the best. When he is elected again on April the 30th to serve us in Cayman Islands, I would like him to be the education minister again, because I feel that he done an excellent job, and I'm sure that when he is elected on April the 30th, he will go into the assembly prepared to do what is right for the people, and the people would be happy that they voted for him. So I'll urge people to really vote for him, because he's already proven himself We could send Ralston to anywhere to represent us, and I feel like he would do a good job. We don't have to sit in our seats and be scared, oh, what's he going to say next? Or, is he going to say the right answer? Because I trust him, and I know I've proven him the way that he speaks. He's quite eloquent and well-versed in conversation.
All righty, folks. There you go. Good morning, one, and good morning, all. How are you guys doing today? Okay, we got some open mic opportunity. Instagram, I'm keeping an eye on you guys because I know in a little bit it's going to shut off and then we'll restart your feed. Not to worry, I got you. Miss Joyce Sands said Sabrina Turner, MP for Prospect. Let's keep her in. I can attest to her work for the people of Prospect. And in case you guys missed it this weekend, she did have her annual Easter event, Easter party. Yeah. And so we had an opportunity to stop by and visit with her. And we had a really, really nice time. So it's something that she's done consistently since she's been in office. I can attest to the fact that, she has, nobody's perfect, but she has certainly worked within her community and she's been running her office. And anytime I hear criticisms or areas in which these, elected officials can improve, I don't shy away from telling them. It doesn't matter who they are. I certainly do not shy away from telling them, listen, this is what I'm hearing. Maybe that's not my experience, but as I always say, folks, take it on board because that type of constructive criticism is very, very, very important for you to know, and you can do something about it once you know something about it. So I want to share with you all this morning, if I can. Let me just see if I can. There's two ways I can do this. Let me see how my Dropbox backups are going. I've been trying to get all my backups done on this phone because it's critical now that I do it. I know you guys keep hearing me talking about my phone, but I got a 1 terabyte phone and honey chow. Ooh, the 1 terabyte is just about all gone. So I'm quickly backing up stuff with a view to wiping it, at least my photos and videos. I got to have those backed up. And then I'm going to wipe that area completely and start all over again, honey child. I do feel like I need a phone just for videos and nothing else because there's a lot of that going on. So yes, give me just 1 second here. I'm going to show you a little snippet of the interviews that we did on this weekend. So we stopped by and we visited with Alric Lindsay. He had his Easter event for the kids. And again, this is something that Alric isn't doing just now because he's vying for political office. This is in fact something that Alric has been doing for many, many years. And also, anytime baby pictures come up of Gigi, oh my goodness, those are my favorite pictures. So I'm seeing a lot of those thinking right now when she was like a really young little thing. Oh my goodness, she was such a sweet little baby. She's so sweet. Oh, now she's, honey child, can I tell you all how much this child is talking? Our friend Kevin was saying to me the other day, he's like, child, you better put her in law school because she can make an argument. Good morning, caller.
Good morning.
Yes, morning.
How are you?
Good, thanks. How are you?
Morning.
Yes, morning.
Good. Good morning, everybody.
Yes, morning.
I would be a hypocrite of me not to really say something in reference to Sabrina.
Yes, okay.
Because I work with her, I help her, and I've seen her struggles, real struggles. And You know, the thing I see people saying about quitting and all of these things, and if they know how that woman works, Sabrina is one of the oldest MP that has not left the island but once, and it was for government. She was like, Miss Joyce, I can't take a vacation. This is not the time. The people needs me. We're in a mess. But you know what people doesn't understand? You one cannot do it. They will shut you down when you're trying, because everybody, this was done by Miss Sabrina Turner, this was done by whoever. And that's not the way. We will never go forward if they don't work together.
My apologies, folks. It looks like we had what we call in this world the blue screen of death. The poor computer, I guess, was just overworked, and so it just crashed on me. So everything had to be restarted. So I got that backing up as quickly as possible. So hopefully, radio folks, you guys are okay, and you can hear me loud and clear. We did have Miss Joyce Ann on the line, so let's go back to her. Miss Joyce Ann, are you still there?
Yes, I am.
Yes, my dear. My apologies. You know, it's so funny because when the computer crashed, you were talking about the fact that Sabrina has never taken a break. She hasn't taken a vacation in the last 4 years. And I was going to say to you that everybody needs a break. Apparently, even my poor computer needed a break this morning, so it took it.
Yes,
I mean, this is what happens when you got too many things, too many processes running at the same time. Sometimes the computer says, bloop. There you go.
Yeah.
So yes, you're yes. Go ahead, my dear.
But I was saying that, like you said, she didn't take a break, and I was saying to her, you're burnt out. She said, but the country is in a state, and she needs to do all she can do in her power, and I see people saying she quit. I see people saying a lot of stuff, but let me tell you something. I've been in there with that woman. I watched her cry. I watched her try to figure it out, how she could do whatever to enhance not just Prospect Cayman. And many times, I guess she couldn't tell me what was going on. And I would say, what's going on? She said, well, she can't, but it's not good. And I said, well, some of the people that you all has been working with, I know for a fact this and that. She said, yeah, but she has to work with whoever, that the people give her to work with. And she was always willing to try to work with each and every one of the persons. I have not sit down and hear her saying one thing about them, like awful, like how you see it and whatever. And the problem with that woman, I mean, she struggled to keep afloat with her own funds. Not nobody buying out, nobody giving. I was there when she started that school. And I hope she don't get upset, but she took her salary in advance, for to have the summer school for the kids. And she wanted to make sure the kids were happy, they had everything. And she said wherever they come from, because they were coming from North Side, East End, West Bay, and we were saying, well, we got too much. She said, try to fill in as much as you could fill in from wherever. And, she filled them in from every district. And those kids could come today on your program and tell you how they were treated, how they were fed. And she was the one to start that. And she said it is some way to help a mother to be able to go to work, because it was in the working world, and she realized that the people that had to stay home with their kids because they couldn't afford a helper, they had no way to take them. And she said, we will be giving those mothers a break, because the mothers need a break. And that is what I saw this lady do with my two eyes and hear her. And then I see some of those that commit, and I know for a fact she helped them. She did paperwork in the office. I see them commit. Sabrina did nothing for Prospect. That's why I tell you, when you write up what they're saying, you cannot study people. These people are the same people you do so much for, and they're the ones that have the most to say, believe me. So when you see that there, you have to say to yourself, but it can't be that person. But I don't even waste my time, because guess what? That's why some people always need. That's why some people will always beg. That's why they always be without, because the ungratefulness they have in them, they can't do without. But I would be a hypocrite not to get up and say, being in the area with Miss Turner, that woman has done a lot for Prospect. The signs, the drains. My road be flood for years and years. It's the flood. The first we don't flood is now. When it was going on Patrick Island and they wanted to murder her, she was like, I don't know if I can go home, because the way that they're going on. She said, everybody got to live, the rich and the poor. And she said, they are my people. And I can't go home and lay down feeling good. She just don't blow her trumps or whatever all the time. But that woman had to work tirelessly. And 2 years, it was nothing that nobody could really do besides what she done. Figure how to open back Cayman. So it's only been a year and odd. And I can bring in her manifesto, and majority of what she has said she was going to get done has been done in Prospect. The signs, the drains, and all of those things was in her manifesto. And it's not like she have a pile, because a lot of these had a truckload of people behind them with money and mix up and whatever. That woman's name hasn't been mixed up. It's a house that was transparent with her and me. Nobody has ever had that woman name mixed up in anything, because she runs a clean campaign. She kept a clean office, and we need to put aside who we don't like. And if it was even mean with Sabrina, and she didn't do good, I promise you, I would not walk with her again this time.
Yes.
I would not have to give up, because guess what? At the end of the day, Sabrina's human being and can drop dead. God forbid, or anybody could drop this, forbid. But when we sell our souls, who's gonna carry us? Sabrina can't carry me. It's what she's doing. It's why I am walking behind her. I have never walked behind a politician. Thank God he's blessed me and bless me and bless me. I have never ever walked, but I walk with that lady because I see she had hardly anybody, but she had the right heart, she had the right mind toward my little Cayman Islands. Okay, and that was why I took up the mantle and say, okay, I will do work for you, no cost. I will help with the kids, no cost. And that is what I have done. I look nothing in return. I want nothing in return. I am 60 odd years old. What I want is for my young people to be able to live in their own islands, unmolested, right? And have a job and have a home and have a car. And if I just out there blowing and not trying to do that, and behind Sabrina, because Sabrina's my friend. Sabrina's not my friend. I didn't know Sabrina until election 2021. So it's not like, okay, this is somebody from childhood, my cousin, my whatever. I have nothing to gain. I have no reason to lie to no one. But the truth is the truth. And sometimes, nobody's going to say, we have a habit of not blowing the horn for people when they're alive. When they're dead, they come through all these roses and they tell you all of these things. I want to give it to whoever. When they do it, it doesn't matter if they're my friends or not. Even enough time I comment on things, these people and me don't have no relationship. That is the truth. So I will comment and I will say that's a good thing, because it is. And this is where we need to get. We need to stop saying this and that and that and that about one another. If the person doing good, they're doing good. And it don't matter if you're getting money, because someone called me on Sunday, was telling me how much Miss Julie did for them and this and that, blah, blah, and give them this. And I said, really? And I say that out because it's the gospel truth.
So here's someone who doesn't share your view, and it's so interesting. Sophia says, no offense, but honestly, Sabrina never really done anything for Prospect that I can talk about. So I have to wonder, because she says, first I'm hearing this. Again, maybe this really is a situation where some of these MPs, especially when it's the truth, need to do a better job of tooting their horns. It's the same thing with Alric Lindsay. I was saying to Alric the other day, because he said, when he does stuff in the community, he no longer posts it, whatever. And I said, that's why you have people like Nola Brown who can get on his platform and say that you haven't done anything in the past 4 years. Where have you been? And Alric has actually been a lot. He's been doing a lot. And people Windsor Park, those who know that he has been a consistent fixture there. He's not just shown back up now just because it's election season, but because he did not want to, in his own words, he did not want to put the plight of poor people on display, right? Because there's pride. People still have pride, even when they reach out to you and they ask you for help. So he didn't want to put that on display, but he's been silently helping. He's been doing his school drives. He does his little Christmas annual events. I'm going to be honest with you, Sophia. I'm going to have to disagree with you because the fact that you haven't heard about the summer program, she even came on here, just a second, Ms. Joyce Ann. She even came on here the first year she did the summer program because they tried to castigate her about the fact that she had to add on a deck onto the back of the MP office in order to accommodate like staging for the children, staging for her Christmas programs and all that kind of stuff. And they were castigating her, Sophia, talking about how she didn't go to planning and she didn't do this and she didn't do that. So I'm telling you, Sophia, you ain't been paying attention. Even Jasara said, I'm from West Bay and I heard about that. So give people their due. I never will deny what people have done. The issues that I have are the people who jump up and claim that they're doing something and they're so vague because they can't give you any specific examples. We can give you lots of examples. Honey child, Sophia, ask yourself, when was the last time before Sabrina Turner got elected, when was the last time Prospect even had a Prospect office, a constituency office? They definitely didn't have one with what his name is, who was there before her again? Austin. They didn't have one with Austin. He never had any office that you could go knock on. Every year she does her back to school drive. She does her annual Easter program. She does the Christmas program. She does a summer camp for the kids. She's been putting these on and not for nothing, but she had an MP office before she was even elected. When she decided to run, she went and procured that office and started doing stuff. She has food there where if you're in the district, she has partnered with the, what's it called? The food bank. And you can go there and get little packets of chicken and canned foods and stuff if you're in need. So yes, honey child, that means that you're just not paying attention. And sometimes we don't pay attention because we don't want to give people credit for what they are doing. You know what I mean? So sometimes we have to be prepared to look at our own biases, and we all have them. I try to look and I say, okay, let me take, for example, Donna Bush. I like Donna. She's a nice enough person. But when she talked about how long she's been working in the community, I was like, other than Miss Cayman, other than the pageant world, what has Donna done in the community? The fact that she couldn't give any specifics about what she has done, makes me put a big question mark over what she's done. But when people can come to you with provable stuff, with specifics, take, for example, Alric. Miss Romelia can testify that he is very, very supportive of her seniors program and of her Cayman Kind Action Committee. And he's making donations and assisting in any way that he can all the time. Some of these other people, these Johnny come latelys, they have done nothing in their communities, and it's not because Stacey, it's not because they don't have the resources to do it. They may very well have the resources, but they don't have the desire. I thought Stacey was bringing me food, honey child. They don't have the desire to really help, and then it becomes something that they'll do it because now. Let me get on here and toot my own horn, because now I'm going to toot the CMR horn, right? We have encouraged them, especially the sitting MPs, to come on this program and talk about the things that they were doing. You all heard me throughout the last 3.5 years. Come on, come on, come on. Because you know the old saying, if the tree fell in the forest and nobody heard it, did it really fall? You heard what Franz Matterson said? No more silent victories. We have got to be prepared to tell the people what it is that we are doing. And I think government needs to do that. Elected officials should be on here at least once a month when they're in office. What are you doing? What have you been up to? And I have challenged them time and time again. The only one that committed to doing it on a regular basis was Wayne Panton. Now look at the irony of it. Because Wayne Panton was committed to doing that, and even him didn't do it as often as I would like, but more or less he was coming once a month, right? He did the interview about the economic state of the country before they kicked him out, and now they want to blame him on the economic state of the country. There's an actual video where he talked about it. We did a whole article on it. Is Cayman broke? Let's sit down with Mr. Wayne Panton and discuss it. These things are also important to do, because when you remain silent and then election time, they want to throw out all these, convenient narratives about you. You can go back and say, but hold on a second. I spoke to the people back in September, October about this, right? The UPM government trying to take credit for the increase in stamp duty waivers that Caymanians will now benefit from second and third properties, and increase the amount. They can't take credit for that, because anybody with a little bit of sense can go back to the interview that we did with Wayne Panton when it was him that was pushing for it, and he broke it down and discussed that when they went back to Parliament, they would be able to formulate it, but he was already doing it in practice. He was already giving it for second properties, but they wanted to make sure that it was in the law so that the banks could say, we know that this is going to happen. We don't have any doubts about it. So how can the UPM take credit for that? They want to revise history. They can't revise it when you have a CMR interview from well over a year before that proved what the real situation was. And this is what I keep telling them, why it's important to come on programs like this and talk about what you're accomplishing and what you're doing. So, of course, now they try to castigate poor Wayne. Oh, yeah, he's always on CMR. But you know what they say behind closed doors, Miss Joyce-Ann? Them same ones who are trying to kill him, they come to me when it's election time and say, oh, we want the same deal that Wayne Panton has.
Yeah.
And I tell them, I say, Wayne Panton not got no deal. What deal you think? The deal is you show up. You show up and you talk to the people. Even when you're not comfortable doing so, you show up and you talk to the people.
That's right.
Reach out to the people. Communicate with the people. And I'll be honest with you, I've also put TCCP to task. I've said, listen, you guys need to improve your communication engine.
You put Sabrina to task.
All of them. So
you give it to her.
They need to, when it comes to communication, and I get it when they're in there, they get busy and all this kind of stuff. But communication's important.
You want to sign up for the people. But Sandra, I think it's more about me with Sophia than anybody, because she had cussed me out on your page before, and we went back and forth. Yes, we did good for Sophia. Yes, we did. And she went and she cussed me out on the platform, but I'm not going to get in. And this is what I'm telling you. They crucified Jesus. So why won't they crucify us? These is the same people that you will help. And I don't know why they do that. Why they come and say that. And, and you can't stop them because they're growing and whatever, but it amazes you. You understand that you were going away to do good.
Yeah, I mean, fair is fair. You got to be fair.
Yeah, and you still treat them just like how you treat everybody else, but for whatever reason. And a lot of things Sabrina can't do. People come there for NAU, and we tell them that, we will do the application and we will do everything. We will help them. But that is not Sabrina's ministry. Plus, that's interfering, so we can do so much. So sometimes people come for certain things or want things. There's no way Miss Turner could do it. But what she could do in her power, she has done her best to do it. And the truth is that there's people here that are saying yes because they know.
And I will say, from the ministerial perspective, right, while we had other people who wouldn't come on and wouldn't let their ministries come on, I must say that Sabrina never appeared to, because her ministry came on more than anybody else. And big shout out to Miss Catalina Ferreira, who often was reaching out to me saying, hey, we have this initiative, we have this, whether it was the health survey, we have things going on. So, the health ministry, they were always on here talking about some of the things that they're doing. So kudos to them as well.
Thank you. And the thing is this, the next thing, right? Like I say, Ms. Turner probably don't probably get upset, but I have to speak. They're murdering Sabrina. Michael won the last election. Nobody has seen Michael in 4 years, but he's the best thing. These are the same people that they're hypocrites. They're there murdering her, and they're saying he's the best thing. Okay, you run and you have intention to run again. Where are you for 4 years? You understand me? You should keep up because your interest shouldn't be just about the election. Your interest should be in the people of Prospect. So you should still be on the ground where people could see you. You comes 4 years later and the people say you're the best thing. But now they would have want to murder Sabrina and they won't forgive her according to them because she quit. She didn't quit. She decided what she had to do.
But listen, hold on a second now. When Alva Saku was quitting PPM multiple times, when Dwayne Seymour was quitting PPM and UDP, when Juliana O'Connor Conley was quitting PPM and whatever, when Arden is now up in his feelings about quitters. What happened when he quit PPM? And the flip-flopping on the back bench and all that kind of stuff that happened as well. I mean, they seem to forget quite conveniently when they were quitting and flipping and flopping all over the place. Nobody has quit a party and quit this and quit that more than Juliana O'Connor Conley. When they were cutting McKeever's throat to take over the government. What about all that?
Thank you.
I mean, y'all want to talk about quitters. What a hot mess.
Oh, man. They just got to look in the mirror, majority of them, and they will definitely see quitters. Sabrina never quit. She was in her office after she stepped down every day, still serving her people. She just stepped down as an MP because they would have passed more than they did. You'd think we're in a mess now, we would be in a bigger mess. And the problem with her people, they does not understand the concept of how the country is run. And this is a major problem that we have. If they understood the way the country was run, then they would understand why those three decided to step down to save many. Yes, they was there because they said, why not before? Why not before? It's because you're trying to hang on as long as you can because you see, you're in there and you hearing what's going on. You're seeing what's going on and you see what's coming. So you stick in there to try to stop it. But when you realize, like, okay, I'm going to go down with it too, because people's going to think I am a part of it. Let me get off now and pray to God because I get off.
And not just, let me be clear, it wasn't just that people were going to think I'm a part of it. They actually left in order to stop some of the initiatives, feeling that, okay, this is the only way we can stop the government from continuing this disastrous situation. And all they did, which I guess they didn't expect them to do, was form the minority government and said, oh, we're going to continue to do what we want anyway. You know, here we have the country saying that they, not the country, but we have this pre-election report saying you guys are in financial problems, and they're still finding money to throw at churches and other frivolous things, as far as I'm concerned. It's absolutely ridiculous.
I'm amazed. You know what I mean?
Yeah.
The same thing they said no to, like the HSA that Sabrina wanted to actually name after Mr. Anthony, and it was there. No, but all of a sudden, when she's out of the picture, boom, there it goes. We're naming it after him. That is wrong, and this is what is going on. So it looks like, oh, you didn't do anything. But that was what I was asked to do. But you wouldn't do it because I was then in charge of the ministry. Yeah? The same thing with the
timing of that, and I haven't really talked about that, so let me be very, very clear. I support Mr. Anthony. He has contributed so much to this country. You know, we don't agree obviously in his position as it relates to certain things, but you know, who's going to agree on everything? But he is well deserving. The only thing I would say is the timing of this. It's obviously all about politics, right? That's what this is all about.
Exactly what I'm saying, because he deserved it. He over-deserved it. And there's nobody, that's why Sabrina wanted to give it to him. So it was like, nobody was saying that he didn't deserve it. Just the way that it was done. It's the way the other one was done, like Ponciana. You know what I mean?
All right, Ms. Joyce-San, thank you so much, and do leave me there. Appreciate it.
Baby. Have a good day.
You too.
Bye.
All right, my dear. So yes, I mean, people are flipping and flopping all over the place right now, and it's certainly your right to be a fish and flip and flop. That's completely up to you. But you know, once again, I say that a lot of times the evidence is there. You just need to look. Good morning, caller.
Yes, ma'am. Good morning. I didn't want to call, but I heard you say something that made sense.
Yes,
kind
sir.
of like that. that 3 months discussion on what they do for 3 months, they should have to give an accountability to the public of what they're spending so that you can see what they're doing.
Yes.
But nobody ain't giving account for nothing.
Yeah.
On the other hand, Miss Sabrina Turner, they wouldn't give her any money to do anything. She needs to stay there. She's a good person. If she wasn't good, the community wouldn't have left her. They would have done the same thing that they done to Panan. You see?
Yeah.
It's them that ain't no good, sweetheart.
Yes. Thank you, my dear.
Anyway, thank you.
Appreciate it. Mirror Star says, Sandy, a lot of them just don't like Sabrina MP for Prospect, control her for no reason. The woman do more, do for more than her community. Well done, Sabrina. And I must say, I think that that's very, very true. And you know what? Just the mere fact of her having an MP office. Red Bay, where is your MP office, Red Bay, under the Progressives leadership? Where is it? It doesn't exist, and it has never existed. And yet, I don't see you guys saying that Alden never did anything. Some of y'all are still up in your feelings, talking pure foolishness about how much this man benefited the country. I'm just like, what? Are y'all crazy? Oh, honey, child. Bring it to Jesus. As I told the church man with the church sos yesterday, take it to Jesus. Go to prayer and take it to Jesus, because he will deliver you with the truth. Y'all have got to come with the truth now, honey, child. I'm just saying, I'm trying to find the video about the whole stamp duty thing. I think it was in October when we did the interview with Mr. Panton on the stamp duty concessions. That's when we aired it. Let me see if I can put my fingers on it. Because again, I'm not making no stuff up. I'm telling y'all how these things happen. I don't have to defend a single one of them. The record is there for them to defend themselves. But you see this message I got? Somebody was sending me this about Arden McLean resigning, and they say, and got the nerve to go West Bay and talk about quitters. Alva Saku quits official opposition group. He's quit PPM. Y'all want to talk about quitters? Look at Juliana O'Connor Conley. God knows if she quit anymore, y'all wouldn't know what to do with yourselves. It's like, come on now, get it together. All right, let me, I'm still trying to find that video. I know I did the interview. I got to just see if I can put my fingers on it. Anywho, so there's lots of examples, folks, of people working, and there's lots of examples of people not working and telling lies about what they were doing, and you guys just need to put it together. The evidence is there. Can somebody from TCCP help me out with this video? They probably don't have it themselves, but I know it's on Facebook somewhere where we demonstrated. I can demonstrate to you this morning that the stamp duty concessions that are benefiting Caymanians that the UPM government is trying to take credit for, that actually happened under Wayne Panton's leadership. I'm just saying, honey child. It's convenient to talk about somebody is a quitter and this and that, but when you look at the facts obviously say something very, very different. That's all they got? That they're quitters, or they're gonna quit on you? Really? When they were trying to stand up for the people of the Cayman Islands, but not being a part of a runaway train? Lord Jesus. Let's talk about Sabrina some more, because again, I have been critical of Sabrina, but I believe in giving people credit where credit is due. And so I have evidence here, right? You guys can actually go back once again. That's why I love to do my community videos. That's why CMR gonna be launching her CMR TV. You can look it up in more ways than one. I tell you what, she was doing an amazing job in her constituency office. And I've always said, she has a very well-ran constituency office. So much so, I hope my computer not freezing again, it's taking a minute. So much so that other people from other constituencies have been coming and looking for her and finding her office in order to take advantage of those services, coming all the way from West Bay, East End, all over the place. All right, so Sabrina, we know you've got about 3 weeks left in the campaign. I'm sure there's a lot more going into the home stretch. So tell us a little bit about what you. So this is
member running for electoral office.
Oh, that's not the one I was actually looking for. But one thing she says, I think it might be in here. Hold on one second. Let me see.
People just invite me to their homes, and when I look, you're thinking you're going to meet a family, and sometimes you're meeting 6 and 7 families, which has actually assisted. And in between that, then you're doing your door-to-door. But what a lot of people have also been coming is utilizing the office as well, because even though I'm an incumbent candidate, and right now as a regular minister, no longer being a minister, I've reverted back to just being a member running for electoral office.
Right.
But this office is still being paid by the government. So I have a responsibility to still be here. And this is open from 10:30 in the morning. If we're out doing, well, you know, the home stretch for mobile voting now is the 17th. We're doing that, assisting our shut-ins and all that sort of stuff. But I still show up here unless I'm pulled out to meetings, because I know that responsibility of running a constituency office.
Yes.
So I'm here from 10:30, 11 o'clock. If for some reason my office assistant and I are going out, there is a notice on the door. 99%, as it is campaigning time, we're in the constituency, not that far by. But you can reach us by phone, 922-8080. 746-9314 is the landline. 922-8080 is the constituency mobile phone. But that is my responsibility, being responsible, because the government is still paying for this, even though I haven't yet been re-elected, but I feel it is a moral responsibility for me to keep this office running, because it is the people's money, and that's why I'm here.
Fantastic. Well, thank you so much. We're going to watch
you.
some
As you
of the
can see, we
races
got
now
we
with
got a
the
couple
kids.
races.
So, let me ask y'all a question now. Come to Auntie and answer me this question. How many of you even knew that that was the case? That although it's campaign season, they still are getting funding to run their electoral offices. And here we were just informed by the former MP, because right now she's not technically an MP during this campaign season, that her office has regular office hours. You can find her there, and they're still open. I'm just saying, nobody else not telling you that. You know, look at people's history, because a person's history will tell you a lot about who they are, even when it comes to if they'll be a good representative of the people. Wayne Panton maintained and kept an MP office open for 4 years when he was not even an elected member. And people could still go there for 4 years and get stuff done through that office. Now, Alva is my friend and former colleague at Maples and Calder. But let me be very, very clear. Alva has been busy living his own life and doing what was in his best interests. I'm not saying there's anything wrong with that if you want to remain a private citizen. But you cannot be jumping up and running again for public office when all you did for the past 4 years was go to law school and look out for you. You not done nothing in the community. You not done a single cleanup. You not pick up one piece of garbage as a community initiative or drive. Wayne Panton is going around putting in parks for our children in the community at his expense, not even using government money. Come now. Now, not everybody can afford to do that. But you know what? There's a lot of people who can't afford to do it who are still not doing it. Think about that. How many of these big wigs coming along now? Ex-partners at this place and that place, running multi-million-dollar businesses, getting you to buy from them, all sorts of stuff. Ask yourselves, what have they done in the community? Huh? You can't just jump up now. No. Natasha, good morning. Says, give Alric and Sabrina their flowers for working without it becoming a photo op. People are committed. Here's Natasha. Already has her constituency office earmarked. The future home of Red Bay's constituency office, something that Red Bay has never had under the PPM leadership. He did not even see it fit to have a constituency office for the people of Red Bay. And he was the premier of this country. You can imagine. Come on now. These governments have failed you, and you all continue to want to give them opportunity after opportunity to get elected and in public office. and I do not understand why. Irvelin says Miss Donna is running in my area, and I've never seen her until she was on the billboard. I'm just saying. What's been done in the community? Like I said, she might be a nice person, but this is not about nice people. Let me talk about Miss Romelia for a second here, because she's another one that y'all are like, oh well, you know, she can't beat this one and that one, and oh, you know, her sentences, she can't form a proper sentence. But one thing I can tell you she can do is Romelia can get stuff done in her community. She's taking seniors out, getting them out of the house so that their mental health can improve, taking them on trips, Cuba, Panama, they be all over the place. They be traveling more than me, right? Trying to get them a community van so she can have people pick them up and bring them to the senior center, bringing them out to play dominoes. These are seniors that if they didn't have these activities, well, government surely isn't providing it. So she's providing something that our own government with $1 billion budget isn't doing for seniors. And she's still getting it done. And you have MPs in those constituencies who don't even assist her in any way, shape, or form. She's taking up beautification projects, right? Yes, she's picking up trash in her communities. But imagine if she didn't do it or nobody did it, what her communities would be looking like. She's encouraging young people to join with her. The boys to men guys, young men, taking them out, making them do something productive with their time on a Saturday afternoon. Begging people to help her purchase paint so that she can, I'm still trying to find that stamp duty video, so that she can, this was September of 2023. Yes, so that she can find, but where is the video? I know we did an interview around this. I'll find it. I got to get one of my CMR teams to help me find the actual video. Now that I have a date that's helpful, I'm going to message them real quick. So yes, I mean, listen, you know, you have to tell the truth. Interview with Hampton around this time. Because I remember doing the interview with him because he was explaining exactly how the stamp duty waivers would work for the additional homes and stuff like that, right? People who have demonstrated a commitment is who you need in there. Jasara says they know, they just don't want to give her credit, and it's sad. What a hot mess. Anthony, good morning, sir. Says that's true, Sandy. Most of them have not been seen in the community, and now they're offering breakfast, meet and greet, and they have a few on the campaign trail that are civil servants that are paid for their service, and they're using that as community involvement engagement. Please. Miss Lucille, good morning, says, thank you, Miss Joyce Ann, for speaking up for Sabrina. Leave her alone, let her strive. Don't worry, Sabrina, God has your back. Sandra says, ungrateful, greedy people. I understand that some material she purchased from her own funds was stolen in the height of a storm. Some people are just unreal. Thank you, Joyce Ann and Miss Sabrina, for all that you do. Gabby says, now I haven't heard from Mr. Gonzalez. And here's the shocking part. This is where I'm very, very disappointed in Uncle Arden, honey child. Raul Gonzalez don't do nothing for the people of Newlands. I lived in Newlands, several houses down from Raul. And every year this man jump up and run for political office, and he don't do jack, you know what? I mean, nothing except expanding his yard onto private property that don't even belong to him. That's all he's there doing. If that man build another birdhouse on other people's property, try and call that American woman and tell her must come for him. Because next thing you know, he'll be claiming that he has squatters' rights on her property. This man has done nothing. He just jumps up and run. And then Uncle Arden, you are going his campaign and try to support this man, talking about he's a better option than we in Panton? What kind of funny stuff you smoking? He's a better option if you don't want somebody to do anything, that's for sure. I'm just saying. Irvelin said we've had 2 occasions where tropical depression flooded the streets in my area, and not one politician walk or drive the area to check on the people that lived in Saddle Woods. Well, I'll tell you one person that was driving around during the storm, and again, the evidence is there, was Ween Panton. Remember that storm? I think that was Was that 2023 as well? Or 2022? I remember one woman had a tree fall in her house right in that area. The only person that was around was Wayne Panton. Me and him went out for a drive around. Do you guys remember that? Because he had the poor driver being, he's driving the driver. And I'm like, why is your driver in the back seat? The driver just laughed and said, boy, that's how Mr. Panton is. He don't even want me drive him. He driving me. This man was out in the community checking on people. And I was in such awe of his knowledge. Come, Stacy. I was in such awe of his knowledge about where people live in this area. And he's looking at the plants and the birds and talking about every little thing. I was just like, oh my God, I had no idea. Sort of the average countryman, if I could use that term without offending Mr. Panton, that he is. You know? He's like, yeah, you know, I remember when this area, and then he talked about the areas that are prone to flooding that have always been prone to flooding. I was taken aback by his knowledge and expertise. I can't find the video right now, but permit me to share the article from September of 2023 that clearly demonstrates concessions increase for first-time Caymanian homebuyers. That was before UPM government tried to take credit for it over a year later. Because they still weren't able to, even when they took over the government the following month, it took them a whole other year to finally get to Parliament and pass 1 gazillion bills. Good morning, Carla.
Hey, it's me again. I just heard you speak about Mr. Panton in his own car. That was the next thing with Erna. She never took one of them. She drove her car, drove herself. She said that was an expense that government didn't have to spend on her.
Yeah.
Okay? And that is how she tried to save money. Never took one of those cars. Said she didn't want one as a minister. Her car was okay for her to drive. That's who Sabrina Turner is. They're not looking for people that's trying to spare the government money. They're looking for those that putting us in debt.
Exactly.
I don't understand people. People is talking about they're quitters, right? Look at how many times those in PPM has switched from one to the other, and the same PPM people is cussing TCP, and they have switched.
I mean, not for nothing, but Kenneth quit PPM too. Kenneth quit PPM. He quit opposition. How many times?
That's what I'm saying.
How many times has Alden not castigated and said that, oh, Kenneth can't stick up, he can't do this, he can't do that because he keep quitting, not even the opposition want him? I mean, come on now. They went on and on about Kenneth too.
Thank you. And where is he? Right there. Bunch of hypocrites. But just because somebody wants to make someone look bad, that's why they do it. This woman would not even take a car. She told him she didn't need one of those tacos and this and that. She was good with her car. Drove herself every day to work and showed up for work. Most of them didn't even go in. Every day that woman showed up for work. Okay? So this is what they don't want.
John is allergic to the government building. He's allergic to work. But yet he has the nerve to sit down and talk about, this is where, again, it's so shocking to me. He's allergic to work. He's allergic to the government building. But he has the nerves to sit down and talk about, oh, you guys shouldn't vote for Robert. Meanwhile, Robert is one of the biggest hustlers out here, working hard for himself and his family and making a contribution. He's not afraid of no work. Anyway, leave me there, Miss Joyce Ann. They're a hot mess, child.
Okay, sweetie. All right,
yes.
darling.
All right, darling. They're a hot mess. I mean, the foolishness that they come up with is quite shocking. I'm still trying to find that video, man. Thank God for Facebook, but sometimes you're looking for something, you still can't find it. But I know now it's around September. Let me see. Anyway, I'll keep looking for it. I'll put my hands on it. Don't y'all worry, because I know it's here somewhere. That's for sure. All right. Let me read some more of your comments. Radio folks, you're going to be off in about 3 minutes. Sonia says, please leave Alric alone. I've been living in Windsor Park for over 40 years. He was there when I had death in my family, also surprised me with a gift on a special occasion. He's a pillar in the community. Yes, thank you, ma'am. I mean, this is what I hear. I don't live in Windsor Park, but I hear this from the Windsor Park folks, but CINP is trying to paint a very, very different narrative. And I'm sorry, but I have to call them out for their, what I call revisionist history. I'm talking about, Alric hasn't done anything in the community. I picked up the phone. I called Nolly myself. I said, Nolly, I get that you're team CINP, just like when you were team PPM. I tried to warn you, not all that glitters is gold. So don't you be defending people unless you got facts. And I saw him put up a comment about Alric, and I said, I want you to know that what you're saying about Alric is not true. He has been in the community. And as someone who lives in Windsor Park, I would have expected him to know that. So it's maybe not a question of him not knowing it. It becomes a question of, he's not going to now say it and share it because it does not make his people that he's supporting look good. And I don't care. I like Gary Ruddy too. He's a lovely person. But, at the end of the day, if we're talking facts, we're talking facts. When it comes to being in that community, the facts are that Alric has been there. He has been there. Good morning, caller.
Miss Sandra, good morning. I'm Bianca. I've been working at the Prospect Constituent Office for 3.5 years with Mr. Bruno.
Mm-hmm.
And I am so frustrated to hear the negativity from people.
Mm-hmm.
I have always been there. And for who don't want to believe it, we have proof. They can come by, they can see pictures. We just don't need to wait for election season to have events. We have been having events before she got in. She has been there in the community. It is so painful to hear people talking when they do not have the proof, just because they want to make her look bad. I be there all the time, and it is facts of people coming there. If that office was utilized by the Prospect people, that would be amazing. That office is usually utilized by people from East End, West Bay. And it is sad because the first thing they would say to you, they're told, you need to go to your representative. That is not how we operate. From they have a true story, immediately. I personally have walked to Macrock few times to make sure that I purchase groceries. And it's not about talking, it's about facts of helping people in need and their other constituents. So they're not going to find someone like Sabrina that is so genuine. So I know for me working there and I am hurt, I can only imagine how her as an individual feels. Yesterday, I heard Mr. Michael pass a remark that you do not need an office to service your people.
Wow.
You do. You do.
Wow. Well, we know what we can expect from Michael if you don't think you need an office.
Well, you do. It is imperative to have an office.
Yes.
Because sometimes you have people just there venting and just giving them that hope they are so grateful for. So when you think that...
And how are they going to find their MP if you don't even have an office?
Exactly. And although Ms. Turner used to be having her constituents days on Wednesdays, if she couldn't come in on a Wednesday, she would make sure on Thursday she is available. On Friday, she was available. She worked at the administration building, but she was there for her people, and she is still there, and not only for her people, but for the country. People need to wake up and look at the bigger picture of it. It's not just about what you can get at the moment. Look at what they're doing for the country.
Yes.
I am not speaking just because I work there. It's passionate to hear people talking so negative, but yet I know exactly what that office do because of her. Yep. We are the face representing her. Thank you.
Thank you so much. And Salvin is here. Island Pro says, Sandy, do you know of any upcoming meetings for Georgetown Central area with the Ramon guy? Or did he already have? I know he's had some and more to come. Let me just confirm which ones are next, because we have been posting them, Island Pearl, on our page. Of course, they're advertising with us, so we're posting everything that they provide. So please ensure that you look there. But let me address Salvin, because Salvin says, with all due respect to the caller, why 6 months before election? Now, I'm supposing, given the time of this comment, that this would have been a situation where he was speaking to Miss Joyce Ann, right? Selvin, you have got to get out of your own way when it comes to this sort of thing. I'm going to be very, very honest with you, right? All you have to do is go on Facebook. And this is why I say the evidence is there, right? If you go on Facebook and you even look at what I have covered on Sabrina Turner, her events, her Christmas events and all that kind of stuff, I can assure you without fear of contradiction that you will see that the evidence is there. That's all you have to do is go and look. The fact that you ask these questions as though the information isn't there and it's not available really, really shocks me. Here's one headline. The Honorable Sabrina Turner shares recent initiatives. This was back in, let me get the date for you. That was August the 24th of 2022. Let me give you this link. This was not 6 months before the election. Selvin, take off the Kool-Aid, stop drinking the Kool-Aid and take off the red colored blinders that you are wearing. Okay? Here's another one, Impact Wednesday with Sabrina Turner. The date on this, hold on one second, honey child, October the 6th, 2021, right? Sabrina Turner, hold on, I'll come in. Family Fun Day. When was this one? Hold on, honey child. April the 5th of 2021. Let's give you some more examples. All right. This one, Sabrina Turner's Prospect headquarters. We did a tour, April the 5th of 2021. Let me keep going because there's lots more. Hold on, and I'm ignoring all the election stuff and just going to once she was elected. All right. Let me see. May 8th, 2021. That's Mr. Panton. This one was one with Alric Lindsay back in 2021. Let me see here. August 2021, she did something with Caymanian Times. Let me see here. Even Radio Cayman, I mean, they only had 93 views, so it's not like they had a whole lot of people. But that was September 2024. She was on there then. Let me see. Christmas concert with Mr. LeMay playing. We covered that. That was December 2022. I'm happy to send you all of these links, Selvin, so that you can see for yourself that this has nothing to do with no 6 months. Constituency meeting. Prospect constituency meeting, February the 17th, 2022. Yes. Let me see here now. Her Christmas caroling, December 24th, 2020, and she does that every year. So not every year we've gotten to cover it, but she's done that every year. I can keep going. Let me see here. And where has what's his name? What her opponent name again? Michael Miles. Where has Michael been? Where has Michael been? Please, folks, remind me. All right. This person says, blessed good morning, San dearest. Kudos and thanks to Miss Sabrina. Not sure what Heather's doing re-helping persons of her constituency. I will check out Miss Sabrina employment. Well, Heather has also been working in her community for umpteenth years, 3+ decades at least. and she does a lot. Another comment. Good morning. I spoke to my son who attended the skateboard park, and he's of the same opinion of Michael Miles. Bad attitude, behaved like he's king, and was very disrespectful to people around him. That was like 10 years ago. Not sure if a lot has changed with him since then. Well, like I said, I've seen the evidence from 2023 of him cursing and telling out teenage children, so I guess not. Marjorie says, Sandy, do you charge to come on your show? What if they can't afford it? Marjorie, right now, there is a fee. And we said this from last year. I went through great detail and explained how this works. During election season, you don't come on here for free. It's the model now is pay to play. The 3 years and a half before that, they could come onto the program, especially if they were government ministers, and none of them did that. Maybe I got to start charging them all the time, and then they'll find the time to come on. The only ones that consistently did it, like I said, Sabrina came on more than most for sure, was Mr. Wayne Panton. Come again. Faith and Hope says, when will some be thrown in the minimum wage basket, $6 per hour to $9 per pound for food? Michael Wilkes says that's when the UPM/PPM tried to get the National Conservation Act the National Conservation Act. Enough is enough. Roar K-Man says put Sabrina back in. Natasha says toxic colleagues and work environments can lead, to mental and physical illness. She removed herself from the situation, but kept on representing her constituents. Yes, I mean, we haven't even talked about that in great detail, but it's obvious that they were being impacted, especially the women, because, Sabrina talked about how they were talking down to her, and, Mr. Makiva Bush was allowed to sit there and disrespect her. My God, it is absolutely shocking. And her other colleagues, Miss Juliana O'Connor Conley, Christian extraordinaire, would sit there as premier of this country, at least she's wearing the title, and allow her female colleagues to be disrespected by the likes of Makiva Bush. You see, that's why y'all can't put me in there, because I'm going to tell you it would never go so. Makiva would have to get up and get the hell out of that seat. I would tell him, take your big fat ass out of here and go sit somewhere else. He's too disrespectful. And his disrespect has been legendary, especially when it comes to women. So I see some people, and I have a little bite to eat because I need some energy here today. Excuse me, honey child. Thanks to Miss Stacy for my breakfast. That sausage tastes so good today. Wow. I must really be hungry. No, it tastes good for real. I see some people flipping and flopping now. Talking about they gonna support Lonnie Tibbetts. Well, not for nothing, Lonnie. Don't take it the wrong way. But I couldn't vote for you if you were the only person running. No, honey child. You and your vagina monologues? Come on now. Lonnie? I was trying not to say anything about you, but you're trying to take little pot shots at Nicholas when you know. What did it say? You're the better option. Lord Jesus, Nicholas. No. Lonnie, no, you're not. You're not the better option. I am shocked at the progressives. Not for nothing. But when it was convenient for them to do so, they're calling out Makiva Bush for his behavior against women. Okay, let us go back to history and look at Lonnie Tibbetts and his court cases where he was out here assaulting women, including back in 2021, he assaulted a member of the LGBT community. And, y'all are now supporting him? Say what? No, Bobo. I don't understand it. I mean, I read the court file. He said to the security guard, she told my girlfriend that she's a lesbian and that got me upset. And this is why I'm not paying for her food. And then he goes on to assault the woman. This is the best that the PPM can do, Selvin? Let me ask you a question. Step up to the plate. Since you're always drinking the Kool-Aid and you're defending them so much, how can you defend this kind of behavior? I hear you going around telling people to vote for Chris Saunders. And when they put the question to you, if it was your daughter that he was sexually harassing, what would you do? All of a sudden, your mouth dry up. The Kool-Aid can't wet your palate because you couldn't even respond to them. You have got to be out of your cotton picking mind. We are sick and tired of these men having no respect for women. Lonnie, I am sorry. You went to court for assaulting a woman. Pled to a lesser offense. And we must put you back in office? You were fired from Cynical. You were fired from the other job over at the Labor Department. I mean, not for nothing, but it takes a lot for somebody to get fired from government. Because y'all know government believe in giving you 50 chances. You see, I wouldn't be so perturbed if I did not see some of the evidence for myself. And I know people like Joey would be well aware, Joey Hugh, of the evidence against this man, the mismanagement. So you're mismanaging the civil service, spending all this money on renovations when you were over at Cynical. I put the link there for you guys to go back and refresh your memory about the hot mess of a show the shit show he was running over at Cynical. He was more concerned with these Spanish women and putting credit cards between their vagina. And I'm not asking y'all this. I'm telling you this because I saw the picture with my own eyes. I saw his credit card between a woman's vagina because you see, this is how disgusting these men are. They think that this sort of thing is funny. So he put a credit card between her vagina. I'm dead serious. Y'all know what I mean. Right there, vajayjay. And took a picture of that because he's saying that basically he's swiping. That's how he get what he want, you see. Right? Because that's all that women have as an asset for a man like Lonnie Tibbetts. The only thing that makes you valuable to him is your vagina. So he's swiping his credit card through it. He can pay for it, in other words, and he'll get what he want, and you would give him what he want. This is the level of disrespect. And this is who the PPM went and now supporting on his platform and has picked up. Jesus. My God. I mean, I cannot make this stuff up. Putting your hands on women, the level of disrespect. Oh, here's a tidbit for you. This same John on Friday, go and ask. Now, y'all know that I don't know nothing about these bars because I don't visit them and I don't live in the bar. But go and ask John why there's a rumor circulating about him and Skipper. Don't ask me who Skipper is. If y'all know who Skipper is, let me know. John and Skipper got into a fight last night at Zodiac Bar. Where's Zodiac Bar? I don't even know where these places are. But ask him what fight he was involved in on Friday night at Zodiac Bar. I can't make this shit up. Right? Now he's running for political office. And right now, you can't even keep yourself straight during the campaign? Whoa. Oh my God. It is just unbelievable. What a mess. For the person who asked the question about Mr. Auntie, give me 1 second. I'm going to, somebody says Zodiac is down Scranton. I don't know it because, like I said, I've never been to these places in my life owned by Woods. Well, go and check that out because apparently that's where John is down in there fighting. So here's a yard meeting that's coming up for Auntie. This is his list of upcoming residential yard meetings. He's having one today, actually. Today is the 15th, right? Yep. He has one today down Alamo Drive, Crew Road. He has one on Thursday down Martin Drive. And he has one next week, Wednesday, down Canal Lane. So I'll post this up on the page because I hadn't seen this one before. But yes, Zodiac Bar is down in the east. Oh, that's the one down there. Yes, well, apparently he was down there Friday. And I don't know who's Skippy. Is it Skippy? Is that the name I just told y'all? Hold on, let me double check again. Apparently he down there fighting with some Skippy, whoever the hell Skippy is. Skipper. Who's Skipper? Go ask Skipper because you know John gonna lie. Yes, just saw her 9:30. Done reach. Done reach. Shannon says, what a sick puppy. And this is a problem, Shannon. When we elect disrespectful men who've already proven a history of who they are, they don't have any respect for women, right? How on earth? Oh, let me restart Instagram. Sorry. How on earth are we going to expect them to lead this country in any meaningful way? Over 50% of the population of this country and over 50% of the voters are Caymanian women, right? It's no wonder we can't get sex offenders on registry. It's no wonder we can't get protection in our homes against domestic violence and abuse. Because a lot of these same men are the ones who are women beaters. Which video are you looking to see? The picture with the vajayjay? Oh, Lord. I try not to hang on to them things, you know. But I'm sure, because I'm backing up all my photos now, I'm sure they're probably in the phone somewhere. Somebody still got the vajayjay photo? I can't show you all that. When I saw it, I was like, holy smokes. Who on earth does something like that? Skipper is a Caymanian guy who always calling with the sus. Oh, he called in here? Oh, Skipper, give us a call and tell us the sus now. I hear he was drunk. He must be scared of He said, yep, he was down there drunk carrying on. Oh my God. Wow. What a hot mess. This person says, good morning, Auntie. Bust them up, yes. My manager is out of office, so he can listen. Was it not the government credit card in the picture with Lonnie? Zodiac is a whorehouse, so it should be expected that the donkey would be there. Oh, somebody said it's no longer in Martin Drive anymore. It's on Mary Street, where Denzel Club used to be, and called the Globe Club now, owned by Julian Wood. Club Zodiac closed years ago. Oh, what a mess. Well, we don't want no pum-pum swiping men, swiping no government credit cards and no other credit cards elected to public office. We don't want no women beaters, okay? I mean, we have got to have some minimum standards in public office. I am sorry, but this not gonna work. That's the best y'all can do. Progressives, come on now. That's the best y'all can do. I don't. Marisai says that Sunday they kung fu John again. I don't know why John like to fight, because it's obvious that he can't fight. Why he like to pick fights with people for? Only God knows. Skipper's the one who always calls into your show talking politics. Okay, I'm a little friend, Skipper. Well, go on. So are we going to ignore the money that Julie gave to other countries when hurricane hit? Oh, Jesus. honorarium to the civil servants, plus the 5% raise. Oh. I have 3 things here I'm drinking. Let me drink some water. Ooh. The donation to the churches, paying Anna Evans' family $3 million, building the new school. The list goes on and on and on. Where is all the money coming from? Well, that's why we're in a deficit. They're all baboons. I always said I wish more MPs would be like Sabrina. She's the only MP that does every holiday celebration. Halloween, Mother's Day. Oh yeah, let's not forget her Mother's Day lunch. Sorry. Father's Day, back to school, Easter egg hunt. Where Skipper is this morning? Julian owns that? I never knew he owned that. Yes, sir. Somebody sent me a little picture with this man, Micah Miles, saying he's Angry Bird. Lord have mercy. I'm trying to catch up in the comments. So this person says, I give to Caesar what's due to Caesar, even if I don't speak to them. If you would give them all the time, then I'd bet you they'd be talking good about you. It's just personal. I remember you even talking about Miss Kathy Ebanks weeks when she had changed sides or something like that. I mean, everybody gets a fair shake. By the way, does anybody know, we have a lost wallet here. Does anybody know Daniel Tomlinson Brown? An address somewhere in Georgetown, I believe. Your wallet, sir, has been found. Daniel Tomlinson Brown. Looks like a Jamaican fella based on the pictures. And I can actually see one ID says Jamaican. So, Mr. Brown, Mr. Tomlinson Brown, your ID has been found of an address in Georgetown. It has your driver's license, Butterfield card, and some other things in it. We found your wallet. So if anybody knows him, please let him know that his wallet has been found. Oh my gosh. Club Zodiac that's in the East was bought last year by the Flowers Group to expand Cricket Square. It was demolished months ago. Okay, so that's not the one. It's where my uncle's bar is now, Uncle Denzel. I see. Thank you so much for the update. Oh, they're encroaching on the whole area there of the East. My God. Lord Jehovah. What a hot mess. And of course, this person saying that it's time for a change with West Bay West. Please, this person says to give Miss Julie an opportunity because, again, we need to get these men out of there who have no respect for women. And of course, we know that the biggest one in that category is most certainly Mr. McKeeva Bush. This person says McKeeva Bush has prioritized foreigners for years while claiming to support Caymanians, and his actions speak louder than his words. His disrespect, undermining attitude, and predatory behavior are not what we need in leadership. Let's vote for a future that truly represents the people. Hallelujah. Thank you so much for that comment. I couldn't agree with you more. I mean, his actions have spoken volumes about the type of person that he is. What a mess. Skipper. Come on through. Shannon says, I totally agree. PPM is piss poor management. Miss Mary says, I was so proud of the 3 selfless women of dignity and purpose for our country, Serena, Kathy, and Heather. You all keep it up. Go TCCP. I mean, not for nothing, but you have to understand how difficult it would be to be sitting in those meetings week after week and being disrespected by the likes of McKeeva Bush. Lord Jesus, I couldn't. I could not do it. Oh, they sat there for a year I gotta give them credit for that because I would have quit after the first day. I would have quit or punched him in the eye. And we know we don't believe in any violence around. Yeah. So punching him in the eye would be a criminal offense. I'm not going to do that. So yeah, I would have quit a long time ago too. And proud to be called a quitter, if that's your definition of a quitter. I know, Justice said John making you choke, right? Miss Renita says TCCP all the way. Good morning, Justice. Marshall says if the wallet have money in it, it's mine. Try and behave yourself. Brenda says, Sandra, tell the police that you have the wallet. Child, they be sent, Miss Brenda. The police be sending people to me for lost and found. They said, no, you go to Sandy. Don't come to us because you'll reconnect with your stuff quicker. What a mess. Kate says, we have those running for office who verbally abuse women daily, yet speaking so eloquently on the campaign trail. You can imagine? My God. Marshall says, what? Zodiac Bar has upgraded to Mary Street. I guess Pum Pum is going to be like hot bread. Child, I didn't know that Zodiac had such a reputation. But like I said, I don't even know anything about Zodiac because that's not really... Oh, we already... See, we already found him. Look at that. Praise the Lord. Okay. Look at how quick CMR worked. You think the police could solve anything that quickly? I hope you know, Miss Brenda. That wouldn't happen. Let's call his mama and just let her know. Hold on, honey chat. Let me tell, I think we found him. We don't need to post it. Let's see.
Savannah Medical, a very pleasant good morning.
Oh, good morning. Can I speak to Miss Nadine? Oh, she said she told him already.
Okay, just hold a minute for me.
Okay.
Nadine, I have a call for you.
Oh, I think he's been notified. Oh, thank you.
Just hold a minute for me.
Thank you, darling. Anyway, we'll say good morning to Miss Nadine anyway.
Nadine, I got one.
Welcome to Savannah Medical Clinic, where your health and wellness are our top priorities. Conveniently located at Unit 1D number 32
I've
Hurst
been
Road
told
in
that he's been
Savannah.
told, but I didn't want to
Here
hang
to
up the phone
provide
and be rude.
exceptional care with compassion,
then Miss Nadine
professional
would be like,
expertise,
"Who's
and
calling me?"
personalized attention.
Can I help? Oh, can I help you?
Miss Nadine, it's Sandra Hill from Cayman Mall Road. How are you?
Not bad, Sandra.
We found your son's wallet, but I think he's already been notified. So I just announced
I think I called him and told him.
Oh,
somebody, Sydney just called me.
Yes, very good. Thank you so much. All right,
You're
my dear.
welcome. Thanks for calling out. to us,
Yes,
too.
no problem.
Have a good day.
You too.
Bye,
Bye-bye.
Sandra.
All right. So yes, he already, now that I'm thinking about it, that's the Tomlinson. No, that's a Caymanian Tomlinson. How that name is spelled. But you know, Jamaicans and Caymanians have such close connections that we share family histories and a lot of last names and stuff as well. Okay, good. Well, that one was easy to solve. Wonderful. Oh, let me get the number of the person who has it because I don't have it. So let me just get the number. Honey chill. Oh, that's Dr. T's daughter's son. Oh, okay. Oh, yes. When I looked close at the last name, I was like, oh, yes, it's a Tomlinson without the H. Oh, very good. All right. So we found him for you. Look at that, honey child. Beautiful. Yes, it's so nice to get your wallet back. So this is the young man that has it. Let me just send you his number. Looks like a Filipino young man. Thank you so much for being honest. All right. Okay. Beautiful. All right. Good. That one is solved. Melita says CMR to the world. Where were we? OJ Evans says, Ma Road is brought to you in part by TCCP. Aw, poor you. My tweetums. Can I come and rub you on your head, pat you on the head? Oh, you'll be all right. Marshall says, yeah, I believe you. Soon that area will be unrecognizable because you won't see any locals living in the area. My God, I guess that's why that park is going in. I think there's something fishy about that park that don't make no sense. That park doesn't make sense for the people in Central, but it makes sense for Cricket Square people, if you know what I mean. Mm-hmm. Child, let me have another bite of my food. What hot mess. Irvin says right now, I don't know who to vote for. Lord Jesus. Jasara says I can't with you, you know, to OJ. He'll be fine. Good morning, Miss Darlene. As that man said, you know, was that Skipper that called in that day to say, if you don't want to get elected, you don't come on CMR. If you want to get elected, everybody know this is where you reach the people. So all OJ, Brenda making me laugh. All OJ is telling y'all is that the TCCP actually has good sense, that they understand a thing or two about honest marketing. Skipper always call my show. I swear he's the same one that said when Wilson was on that day, if they don't want to get elected, then don't come on CMR. I think that's him, you know. I think I know who y'all talking about. Yeah. Let me see if I can find that video. I'm trying to get better with organizing my videos so that when I need to put my hand in something, I can find it. Yep. Somebody said, yep, Skipper said that. Yeah. Okay, now I know the voice. Yes, sir. You were meeting awfully quiet this morning, though. But John, that's who you were trying to fight, Skipper. I know well. I don't know Skipper in person, but based on that voice, I kind of feel like he would probably thump you in your head. But apparently he was drunk. So I don't know what he's stressed that about. Must be worried about losing the election. My God. Y'all got to be careful with the drinking because some of y'all can't hold your liquor. Lord Jesus. Woo! I can't even. What to say? Ay. Wowee. Anyhow, let me just see here now. Oh, yeah. This is it. I found it. This is Skipper now.
With media and things. So if they're not working with you, they're in problem. So they got how bite their lip, spend their money, come on your show, and you just keep it professional. They keep it professional and they dictate, and you ask questions and keep us informed. But if they're not aligning with you, who you reaching out to the people, they're in problem. They going on. If they go on Radio Cayman, I watch Radio Cayman. What they actually 36 watchers. I said, Jesus, I waste of time. I can tell you that. I look over there what they are. Yeah,
there's an endorsement for you.
Yes, absolutely. Thank you. I appreciate it.
Thank you, caller. That was a very good call. Some very, very good points.
Yes.
Thank you very much.
Morning, Skipper. How you doing, honey child? Did you push John and his drunk self down a little bit? Miss Brenda says, Sandra, if I lose my sanity, can you find it? Oh, my God. Luis says he's in West Bay North and he don't know who to vote for. Hot mess. What mess? Well, I know my options are crystal clear. They're crystallizing. 2 weeks left, folks. April the 30th. Right around the corner. Davian, good morning, sir. So, Sandra, you were something else. I enjoy listening to you. Aw, thank you, Bobo. Love it. Over 550 people still here with me. CMR has the longest reach, says Marshall. So if anyone needs to be seen or heard down, come on down. This is where it's at. I had to chuckle earlier when somebody was like, who was that? Jason. Oh, no. I think Jason was a scammer. Somebody else said something about, oh, I see you here. And then somebody said, yeah, boy, this is the place to be, you know. This is the place to be in the mornings. Who said that? That was early this morning. And I just had to, oh yes, that was that Island Pearl? No, That was Shanier Edwards. I think that was you. Yes, Shanier was responding to, I think, Dawn says, this is Big People Place. What are you doing over here? And Shanier said, this is the place to be in the mornings. That's right, honey chill. We're bringing it to you direct. Oh no, Twinnie says the eating and talking is so triggering. Oh my God, are you one of those people that don't like to see people eat and talk? Oh, sorry. You know, there are whole shows about this. There are people who have OnlyFans accounts where they just sit there and eat and people pay them money to see them eat. So some people love it and some people hate it. I'm sorry, Twinnie Fuss. Some mornings my energy is so low, I need to get a little bit of sustenance. But what I can do is I can turn the camera off so you don't see me. Does that help? 7 says, Sandra, I can imagine Chris got your vote. I need a laugh track right about now. One that says, ho, 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 ho. Lord Jesus. OMG. No, he definitely ain't got my vote. Ugh. Y'all are crazy if you think I'd ever give him a vote again. I've learned my lesson. Fool me once, shame on me. Fool me twice. Y'all better come and slap me bald-headed. Mm-hmm. And trust me, slapping me bald-headed gonna be a real situation because this not no weave, you know. This is me and my little scrappy hair. It's all mine, honey child. So no. No. Yes, this person says, I'm one of those people. It's the sound. Oh my God, I'm so sorry. I'm so sorry. Traffic is at a standstill. Road closed by Grand Harbor heading into town due to an accident. They're currently putting the vehicles on the tow truck, but once vehicles are moved, it will free up. So do not, don't go to town if you don't have to. Keep listening to me. Yes. I think somebody sent me the picture. Oh, hold on. Yes. I did get a picture of an accident or something. Hold on. Let me post that up on social media. Child, I'll be multitasking. So let me just send that to Ali. Big shout out to Recover. They're our sponsors of our accident news and alerts. So they're always letting you know, when something's happening. Justice will be served, says Chris and John would be a perfect couple. Miss Sue says, never again, Sandy. Rohan says, my daughter always eats her food while watching her eating shows. Keep doing what you do, Sandra. I'm not purposely doing it, I swear. So if it bothers some people, I will try to do it less. But there are some mornings when I just need to eat. Like I get up. What happens is I get up in the mornings, I just shower and I get ready and I come straight in the studio. So I don't have water, I don't have nothing. So that's why sometimes you see Miss Stacy. She brings me water and tea most mornings. And then there's some mornings I don't eat breakfast, but some mornings I feel like I need the energy boost. And so on those mornings, she will bring it to me. Yeah, I know what the real saying is, Miss. I modified it, Miss Brenda. I'm going to say, slap me bald-headed, honey, chow. All right. So let me see what else is going on in the world. All right. So this was no joke, but let me tell y'all something. You saw where a auxiliary constable was arrested in relation to that $300,000 robbery. Honey child, OMG. I can't wait to hear who that is. This is why people be like, I don't trust the police, because some of them criminals themselves. An auxiliary police officer involved in a $300,000 robbery. Oh my God. What? We don't have a name yet. That's why we didn't name him. But as soon as we get a name, you better believe y'all gonna know who that person is. That's pretty wild. I was like, you actually thought you were gonna get away with that? Not today, Bobo. Hot mess. Wow. Unbelievable. We'll keep an eye on that one. That was the construction robbery, remember? Cayman Airways had a bird strike on a flight from Panama. So they're having that sorted out. So there might be some disruptions in the flight schedule, but they did send a replacement crew and aircraft from their 737-8 fleet. Good for you, Cayman Airways. So that's going to depart. I think it's supposed to depart last night at about 10:30 p.m. So these things happen. Big news, big court news. A man found guilty in the murder of Devontae Hernandez. So I know the Hernandez family is obviously very, very happy that justice has been served in this case. Very, very unfortunate situation. This was the young man who was gunned down there by Reflections Liquor for Less in town. And I remember going on the scene shortly after it happened. And his mother was there, and I could not imagine the mother's pain. You know, she spoke off camera to me briefly, and wow, I'm at least happy. Only 25 years old, shot at point blank range. There was a young lady who got off, Bianca Vega, who's the mother of the young man who was convicted. She has a child for him, and she was charged with accessory after the fact. She was acquitted, so she's gotten away, but girls and boys, she always seems to like the gangster lifestyle. She better be careful. But anyway, yes, what a hot mess. So that was the big case. It took about 3.5 days to come to a verdict decision. All right, not only are we 2 weeks away from a general election, but we're also 2 weeks away from the referendum. So we're going to start talking about that some more in the coming days. And I want to hear how you guys are thinking about voting in that. Mobile voting, yes, there are people doing that on Friday. And I don't know if that's the only day, but we're arranging for the elections office staff to come back on the show and update us and everything that's going on. Looks like we're going to book them for the 25th, so right before election. Just says what? Bad boys, what you going to do? What you going to do when the rent is due? You better find a way to pay it, honey child. Justice says everyone is saying that Fred is the one who set it up because the men are from East End. All of them are from East End, including the auxiliary officer? Well, listen to me. You know how this can go down. I always said this kind of sounded like an inside job to me, but you know, I'm just an amateur detective during the day. My real job is here in CMR. But if Fred had anything to do with this, I can tell you what, I do not believe those men are going to hold that for Fred. They're going to sell him down the river like I don't know what. So that's coming. Just wait for it. As the news starts to tighten on their necks, if it was Fred, I want to know where the money is. How do you steal $300,000 and not do anything? How do you steal $300,000? How are you going to spend that? That's why I don't even like cash. Somebody gave me some money the other day and I was like, oh man, cash, why y'all giving me cash? I don't like cash. Because I like to be able to, you know, when you have cash, and this is what my aunt always used to say, boy, you see that American dollar that got the eagle on it because it flies out of your hand. And I find that when you have cash, it seems to go even quicker. But yes, it's, what a mess, child. Fred, you better go and confess now and get an early guilty plea in, so that you can turn state witness on them or something. You turn on them before they turn on you, if you were involved. Brenda says, please vote no to the cruise birthing. Please, Cayman. Miss Magdalene. Is that you, Miss Magdalene, in that video for Ralston? Is that you in that video? Oh, you're so pretty. Says, and do you still... No, I still see Fred at the bank cashing his check. Walk around with cash? Oh my God, really? He asking for it. He's operating in days gone by. Oh my gosh. Why don't they just set up, obviously the company's paying him all these construction workers can easily get a bank account. You know, they have the workers' bank account, which is very simple form and stuff. CNB does that, and I'm sure all the other banks as well. Deposit the money in the bank. And also creates a paper trail. He don't want to create no paper trail. Because when he's underpaying staff, not paying them at all, cutting, you know, overtime, whatever, he don't want a paper trail. But you do know you're supposed to give them a pay slip and a contract or something, right? That way he's not doing it. Oh, that is you. Okay. I was kind of wondering when I saw the name, because you have a very unusual name. Not too many people have that name. Justice says Fred is always robbing the workers, so anything's possible. He's the worst contractor on the island and handling workers' money. I agree. We have seen his behavior. Strong Will says the same thing. I believe Fred set that up because he's crooked. And if the police officers hide criminals in the Prospect Marina area and ship them off to Honduras or whatever, I don't expect no better from them. Ooh, honey child. You know, I'd like to put in my predictions for this cycle. Oh, yes, we're going to do a day of predictions and we can talk about it. Another person says, I have a suspicion that Fred and the officer, which are from East End, set that up to get insurance money and then still have the other money that was stolen. Oh, okay. I feel you. I could see that. Yep, it's possible. Fred, you want to come on CMR? All right, should we call the lady who called earlier? Still tons of you here. She called and said she got a problem. Shall we give her a call? Let's vote on it, or do you want to save her for another day? Richard says you need to write a book of Aunt Lottie's words of wisdom. Did I tell you her birthday was April the 10th? And the night of her birthday, the 9th going into the 10th, so that morning, I actually had a dream about her. It was a very bizarre dream. I don't even want to tell you guys about it because I don't feel that it was necessarily a good dream. It was just really, really weird. But yes, I was dreaming about her on her birthday. Davian says, yes, simple as that. Do accounts payment. He's shady. That's why he don't want to do it. If some of these workers are not officially in the books, then cash not traceable. Oh, yes. And that too, Gabby. You're right, because we know he's working people not on work permits. Okay, Marshall said, let's give her a call. So she called my other number. Let me try and remember. Let's see. She called me this morning on WhatsApp. Let me check my WhatsApp call log. All right. Yes. All right. Let's give her a call back and see how we can help her this morning. What's going on? Okay.
Sorry, the number you are calling is unable to accept your call at this time.
Oh, maybe she's only on WhatsApp. Hold on. Let me see the number. Let's see. And I do have a message here from her. Hello, good morning.
Yes, ma'am. How are you?
I'm not bad, dear. How you doing?
I'm fine, thank you.
Good. Yes, ma'am.
So I know maybe a lot of times I write or talk because when I'm angry, I cannot put anything down on paper, right?
Okay.
But the thing is, I'm going to try my best to explain everything to you right now.
Okay.
So
And
someone
just to be
here,
clear, you're on air because I know you said you wanted to be on air.
yeah, I know.
Okay.
Thanks. So I have been here working, and from I get here, it has been nothing but hell. I try my best to cope. I went home in last year, May. I came back because I got a job that was supposed to be live-in. The lady did not want anybody to live with her, so that did not prove fatal, you know.
So you're a domestic worker then, working in the homes.
No, I was employed as a caregiver.
Right. Okay. So you were
was
employed by a
employed,
company as a caregiver.
right?
Okay. All right.
No, the job that I came back for, the first permit I got was a company. That was in December year before
Okay.
last year. But the first job I came here and did was 2 weeks of caregiving, right? So I could not obtain any job, and my job that I had that permit on wasn't paying me anything. And I decided on quitting after the lady put $68 in a white, big, nice white envelope give me. So I quit March. I decided on going home, and I came back because I got to work 3 days before I went home for a living job. That was the one I came back for. Now, when I come back, as I said, the lady did not want anybody to live with her. Old lady, nice, sweet old lady, but you have to go and come. You cannot live with her, right? That did not work out. Now I reach out to this person that I am working with, and I have been working with them up until now. Miss, I have been put down, ridiculed, and everything I can think about. Even to the point where I was ordered to eat at the backyard down by what you call gazebo, where the dog would tie to one side and I should sit on the other side eating. And I was eating at their table. All of a
What?
sudden, I was not good enough to eat there anymore. And whatever I'm saying to you, I have my evidence to back everything. So I'm not afraid. Now, what I really want your help with is to get my passport to go home. How did my passport get taken away? I was living in a very yucky place in town, and this guy that I asked him to get the room for me, but he told me that the lady was going to rent him the room because she said she only renting a single man. So he told her that I am his woman. I tried it, and honestly, I tried him as my man, but it did not work after two engagement, if you know what I mean. So I decided not to talk to him anymore because I was not engaging with him like that. He was now arguing with me every evening, so I stopped talking to him to the point where I don't even say hello to him anymore, right? On the 19th of October, he went outside. He know that mosquito bite me a lot, right? There's a hive that live on this veranda. So he went outside, and I don't know if he noticed that the door wasn't pulled properly, but I get up and I slam it the first time so that he could hear that the door wasn't closed properly. Now he came back, spitefully opened the door wide. By the time I get up, Miss Sandra, to close the door again, this man stepped in the door, grab onto the doorknob with one hand, which would be the right hand, grab onto the door jamb with the other hand. He have a big cut on the inner part of his thumb, right? Look as if he got a slice from something. I have my evidence, as I said, to back everything. When you would have a cut and you jam it on something, then some bloody water run down, right? So I called the police because by this, he grabbed my throat and shoved me to the ground. Now, I did not touch this man any at all. The door did not close, Miss Sandra. And I have been telling these people that they called before I get there. So they asked me when they come if I'm pressing charges. I said no because I was in the point of getting somewhere else to go. Not because of the fact that he attacked me that time, but the muckiness of the place. Even to the point where no water is in the bathroom, toilet is messy and stuff like that. So um, when they question him, they ask him now if he want. He claims that I'm the one who mashed his finger with the door. Now he claims that um, yes, he want to press charges, hence the reason I'm in this predicament.
Oh.
Now, right. So I have been talking to the officers and trying to let them understand that this was not true and the evidence was right there. Because the same time when I was being arrested, because I know that the door did not close any at all for that finger to get mashed. And then, Miss Sandra, if you're a police and you see a finger mash, how come the nail is not blistered? You know how the blood would clot in the nail, right? There was no present of that. Anyway, I'm saying to them, call somebody on his job site, find out where he was, and find some information because the door did not close any at all, which the sergeant did, and find that there was somebody who said to them that, yes, they saw him with the cut yesterday, but by this, they only called, the police called this person, and the person confirmed it. By the time they get to him, he changed his mind because the man I was living with this um, person who is giving the evidence, he changed the coop up to change his mind. So that is what happened. So I have been lobbying with them and asking them, how can I go home in case of an emergency? Because my sister, who I am only a month and couple weeks older than her, she is so sick to the point where she was in bed. So first it started, her hand was swollen and her back was hurting, her foot was hurting. She hardly can move around. This was in January, right? By the time January steps out, February steps in, my sister is no more moving. They did the test, it come back, she is cancerous. She have cancer.
I'm sorry to hear that.
I have been asking them from day one, how can I go home just to see my sister, just to, you know, what do I do to get my passport? First, I was told in December I need to pay $2,000. This was when my boss wanted me to get a passport though in December. Sorry, a bank book. Now,
So your
move
passport
back,
has been taken by who? The police?
right?
Because you were arrested.
Right.
Okay. And what
I
have
don't
they
have a
arrested you on suspicion of?
some wounded something because he have that cut on his finger.
So it's GBH. You don't have the form in front of you.
That's it.
That's it.
That would be it. But I am saying, Miss Sandra, why must you keep
you haven't been charged yet, so you haven't gone to court.
right?
Okay.
But I'm saying, why would you want to be holding just because your law state that you can hold this passport up to 6 months? Why should it take up to 6 months for me to get my passport back when the evidence is there clear as day? Right? This man didn't even go to the hospital. I searched my evidence and get the evidence. When they told him to go, he didn't even go. Right? So I went to the hospital and it showed that my neck was I was being attacked. Right? And this was the following Monday because I went to work and realized I could not swallow. And that's why I decided I'm going to the hospital after in the evening. Anyway, so
Have the
I'm
police taken a
saying,
formal statement from you as yet?
yes, they have. And I told them everything. I had my lawyer, I had Miss Daniels for my lawyer, who I've been trying to talk to and stuff like that.
So why
Right.
isn't your lawyer pressing for the DPP's office to make a decision?
Thank
So
you
that you
very
can
much.
either, because if you go to court, they're going to give you bail. So that don't make no sense, right? And
Thank you very
when you
much.
get bail, you can request to have your passport back to be able to travel, and then you just have to make sure you
Thank-
show up for the court date. And if
thank
they
you.
decide not to charge you, they're going to give you your passport back as well, and then you can go on about your business.
Thank you
So
very much. And
maybe you need yourself a new lawyer. I don't know who that particular one is, but
she just said this morning when I tell her that my sister passes this morning, my son was now living with my sister. What am I going to do?
your
What am I
sister
going
actually
to
passed
do?
away.
She passed away this morning, Miss Sandra.
Oh my God, I'm so sorry.
I have been trying to get my passport to go see her. This is my best sister. She is the one I chat and argue with today.
Oh
They let my sister
no.
pass away before I get to see her.
Oh my God. Wow.
To top it off, Miss Sandra, I do my work. I don't get no complaint about my work. And every day I was being ridiculed. I was being put down. I was humiliated. I was treated poorly. My hours been cut, Miss Sandra. Since month gone, I only get $700. You know what these people do? I have a permit that says care assistant, caregiver. Miss Sandra, would you believe it that they tell one of the client that I am not a caregiver? The same person I'm working with tell them that I'm not a caregiver, I'm a cleaner. What does my permit say?
Oh my
Right?
goodness.
I
Wow.
have been dealing with a lot. The only money I had for the whole month from my paycheck, Miss Sandra, when I finished paying my rent and tried to sort my son out for the month, I can't even pay who keep my son, right? $50 I left within my pocket. $50. And here comes a nice
Wow.
little work that I am capable of doing.
Mm-hmm,
But you,
mm-hmm.
when they were asked by the individual, why can't she do the job? They were told that I am not a caregiver. And what they don't know, that my personality towards people, people gravitate to me. And then the lady said it back to me. I don't let them know that I know, right? They have me using as a domestic helper. So my outline for yesterday that I was supposed to go to work was that I was to go give care to somebody in Prospect. So I am not a caregiver only on your time when you want my help to fill in. I become a caregiver. You see my point? Right? Why? Why is people so like this? Huh?
All right. Let me
And then this is
I think what we need to do here is we need to reach out to do you know who the investigating officer is in this matter?
Connor, Detective Connor.
Detective
I
Connor.
also tried to reach out to him in February and he said he was gonna get back to me and until now. So nobody helping nobody.
Mm-hmm. All right. Let me pull some strings for you here this morning.
Okay,
We're
thank
going to
you.
do this bit off air because I'm going to call one of the senior officers and see if we can find out what's going on with your case. And I'll make a phone call for you this morning because this is really horrible.
And I have a video that I record because I was fed up. So I make record of the last curse out that I gotten. As soon as I reach at work that morning, I start getting cursed. I didn't even put my bag down. I'm a big 46-year-old woman coming Friday. I'm gray in left, right, and center. Why am I being treated like you think I'm
I think you have a couple things going on here. So you do need to, I believe. Do you know if this person that you work for has a contract or an agreement with Cynical?
when I was to go in August, they tell me that the work was already because they were getting it approved by Cynical.
Yeah. So
So
a
I
lot
said,
of these
think so.
caregiving companies, they're really taking Cynical for a ride. So what I would suggest is you need to report some of this stuff to Cynical in terms of them telling the clients misinformation about your qualifications or what your job or work permit is supposed to be. You also need to make a report to WORC because then there's some potential immigration related matters here as well. And I think there's some labor issues that you need to
I
reach out to
also have
DLP.
pension. I also have pension being collected
And they're
from
not
my
paying in a
fees.
pension fund. Yeah.
I have seen where it's been collected, but I have never gotten anything about me noting about pension. I was told that if I'm paying pension, then I should be getting some notification or
Yeah.
something, but I haven't got one.
Right. Yeah. So there's a couple different things, right? So try to put something in writing together, and then you can copy it to Department of Labor and Pensions. You can send it to WRC Enforcement, and you can also, send it to Cineco. We have a caller in the line. Good morning, caller.
Good morning, Sandra. This is Dorothy.
Morning.
Morning. Someone just called me about the lady that's on complaining about a caregiving company.
Mm-hmm.
Well, I don't know. My internet is down at home, so I didn't hear what she said or whatever.
Mm-hmm.
So they said, "Is this your daughter's company?" Well, let me tell you something. You know, there are always 2 sides, 3 sides to a story.
Well,
right?
she hasn't said what company it is. So
Yeah, she hasn't called the name of the company. Anyway, let me
She
tell
go
you
ahead,
about
Miss
this.
Sandra.
Mm-hmm.
This lady, right, has been in a she has a problem. Whatever her problem is, she can't work with people. Now, she was working with someone prior to starting this other company, this caregiving company. She came to event with what do you call it? Like we would have seniors event, the Alzheimer's and Dementia Association. She worked with a lady who had dementia. She got fired from that job, right? The lady from that job works, the daughter of that job works for the woman that she was caring for, works with immigration. We were forewarned about hiring this woman, right? So anyway, I told my daughter about that. But my daughter, she's not like me. She wants to give everybody a chance and so forth. Now, this woman has called. Now, you tell me, my daughter has lost 2 clients because of her, right? But she can't, I don't know. She goes into homes and she will tell you, she has worked in my house. And because I asked her, so, okay, in our private place, in our private, let's say your dining room table, if my husband is eating breakfast or whatever, that's his private area. We have a gazebo, you can have sit outside or sit on the porch or whatever you want to do like other caregivers. She said if she's not good enough to sit at her table, she's not good enough to work here. That's fine. Do take your lunch wherever you want to take your lunch. But she is problematic. She has been in trouble with the police. She's been in trouble with this one, that one, and next thing. And everything. I told my daughter, I told her, you need to get rid of this woman.
Everything Miss Dorothy said is a lie, and that's why I tell her I have my evidence.
Yes, let her finish. Go ahead, Miss Dorothy.
All right. Well, anyway, Sandra, you know me. I don't have any reason to lie. I'm telling you, I told my daughter to get rid of this woman, right? Her work permit was deferred. She then put back in information that, it was, and I know it's going to be, it's because of complaints have been written in about her. So it's not only one person on this island. If there are other people that can call you, why is it that she's always getting in trouble? It must be something wrong with the woman. Well, for me personally, I mean, my daughter, she's totally different. My daughter, she likes her. She wants to help her and so forth. Me, I don't want anything to do with this woman because she's bad news. I'm just saying that. She is just bad news. And to get on my road to talk about something that people are helping her.
Yeah, one second.
That are continue to help her. I think that is so disrespectful. That is really bad.
Yeah.
Anyway,
well, I mean, she hasn't called any names, so I was surprised.
No. No, because the person called me. Somebody called me and said, "Are you listening to my road?" And I said, "No, I'm not because my thing is down.
Okay.
My internet is down. And I can't hear my road." But I say, "Well, let me call in." So the person has me on the phone and listening to on their phone. So I have no reason to lie. Look, this woman, let me tell you something. I have no reason to lie about anything. That's my feeling. I'm just telling you from how I feel about this individual. And I don't like spreading all this thing on the air and things like that, but I need to get something straight. The woman is bad news. And as far as I'm concerned,
because we are not publicizing the things that is going on with us. So then Nobody like to hear what we have to say. That is
No,
why
no,
I
no.
make
Let me
sure
tell you,
record
I
you.
have.
The last time you cursed me out that Friday, I make sure record you, because I am simple saying, Miss Sandra, how does someone just steps through a door? She don't want me to walk through her front door. I'm not good enough to walk through her front door. Now, Miss Sandra, I was eating at her table. I've been eating at her table. This is no fancy place. My daddy's shipment house alone is bigger than what Miss Dorothy have there. It's like maybe 3 times that, right? But they don't know your background, Miss Sandra, and then they tend to do stupid things to you. I have been working with my friend here where we have to clean these villas in Cairo. My girlfriend is the one that teaches me. If you don't have like the blinds are not dirty, Miss Sandra, you would just use the thing and you go up and down. You close them upside down and then turn them back. Anyway, that aside, I was ridiculed for that. She asked me a question. I try to answer. I realize if you answer, you're being rude. And if you don't answer, you're ill mannered. So you can't please. Now, for my evidence, that very last day, that morning, I just walked through the door. I haven't put my bag down. And Miss Darty started to curse me out to the point where she telling me she don't know which family I come from. She don't know what made me so special, why I cannot eat her on the back. I have it on recording.
Miss Dorothy, did you say those things to her?
And that is exactly what I said. I said, if I ask you to take your lunch or breakfast, first of all, you shouldn't be having breakfast when you start work in the day. I said, take it in the gazebo like every other caregiver that comes here. I don't even tell them.
I don't have breakfast, Miss Sandra.
Okay, well,
I don't
lunch
do
or whatever.
breakfast.
So, well, whatever.
Miss Sandra,
let me ask you one
she
second,
says
honey.
that
1 second.
I am to eat around the back.
Miss Dorothy,
She
let me ask you a
I'm
question. When she first
wait,
came,
Miss Sandra, wait. When she says, let me get this clear. When she first stated that I am to eat around the back, the first day I went around there, mosquito would kill me, Miss Sandra. And I realized that the dog felt all around the place. I start taking my lunch hour and leave her compound. I went down to her daughter's house because they are not far apart. I sit on her veranda and have my lunch there, or sit and listen my phone, whatever. When it's time to go back, I go back before my lunch hour is out. So because she's realizing that I am not stooping to what she says, right? Made the matters worse. Every day I was cursed at for no good reason. I'm not being cursed at because I'm not doing my work. I am not being told that, oh, you're not doing this, you're not doing that. Nothing like that. Right?
What do you mean?
What I'm being cursed at? What I'm being cursed at? Only because I am not obeying by going around here to eat with the dog.
Oh. Anyway,
that's all she cursed me
not,
about every day from that.
Miss Dorothy,
yeah, okay.
To be fair to her, is there nowhere inside your house, right? I mean, okay, you don't want her sitting at the dining room with your husband, but is there nowhere inside where she wouldn't be eaten up by mosquitoes that she could sit and have her?
Sandra, I sit out there. Every other person that come here,
that's a lie. That's a lie.
Are you
let her speak. Let her speak.
From I am there, never.
Okay, let her speak. Go ahead.
We have another lady that's working here right now. And she can tell you, I have never told her. She cleaned it out. When Terry Ann came to our house, right? Because I was the one that I met Terry Ann and she wanted a job because I knew her coming to Alzheimer's event, right? And because we have a thing where we support caregivers to come in, and I recommended her. She didn't have any work. Recommended maybe, she get hired, trying to find a job for her. That's what we do for caregivers who no longer have work, and they have 2 weeks to stay on the island. Anyway, when she came, I said, when a person come into your house, you tell them that this is what you can take your lunch out by the gazebo and so forth. Of course, the dog go there. I clean up after the dog, right? There's no mosquitoes. You don't have mosquitoes in the day. You have them in the
Well,
evening.
I wouldn't say
No.
that. The
Well,
80s
like,
Egyptian mosquitoes are in, and those are the ones that carry the disease.
well, we
They're
don't
in the
have
day.
mosquitoes. I've never felt mosquitoes.
Well,
okay,
they might bite
I've
you.
never felt them.
Okay, well, they might not bite you because they do bite different people for different reasons. But
Oh, okay.
mosquitoes
Well,
are
I've
there
never
during the
had
day.
them. I've never had them in the day, and I've never heard anyone complain about them. Anyway, if okay, let's say that mosquitoes bit her. She never said mosquitoes bit her. Okay, I just said that's where she went in. There's a porch. She could sit on the porch. Also,
so you told her she could sit on the porch as well?
Yes, anywhere. I say, but the fact is with Terry Ann, if you tell her this not to do something, this is the type of person. If you say she's defiant, okay. If I say don't sit at the table, that is a problem. So she told my daughter that she complained. My daughter said, well, why could you sit on the table? And at the same thing, I said, okay, if someone is working with me, I want them to respect my field. If I say you have your lunch here or you have your break this way or whatever, this is our private space, right? There are other clients that tell you, okay, they tell you can have your lunch, just have your lunch out in on the porch, or you have your lunch when we're not having lunch, or something like that. But respect what I said. Just respect my my wishes. You don't come in the house and tell me, or you tell you how to clean. If I say this is how you clean the blind, this is how you do it. You tell, okay, you can do whatever you want to do. She is a good cleaner. I must say she's a very good cleaner. But there's things that she missed, and I would say, okay, this is not done this way. Why don't you do it this way? Because you leave the blinds turned up, you turn it down. Then she will tell you, let me tell you, it's always tit for tat with the woman. I have no problem when it comes to her cleaning. She is a very good cleaner.
Just a second, Miss Terry Ann. Yeah. One second, Miss Terry Ann. Yeah.
I am not. Anyway, I think I think her time here is short-lived anyway. So because there are so many complaints about her that I don't know. I mean, it's rather unfortunate. As I say, it's a very good. She's a very good cleaner. Why did she keep telling me this a lie? I have no reason to lie. Why would I have to lie? That's a lie. I don't think I lie about things.
So, I mean, it sounds like her time with your company at least is coming to an end, I suppose.
No, there's a lot of things in complaints and immigration apparently, and that's why the work permit was deferred. That's just it. And it's nothing to do with me.
The only thing why the permit was deferred is that the police record was expired. I have gotten the police record and the permit went back in, right? And the police the permit was there, and I went and canceled it yesterday. Well, as I said, I'm not a person when I'm upset who puts things on paper properly. So then my friend, when I show it to her and tell her I went and canceled, she's saying that I should have form it more like a letter.
Yeah, you're on.
So
yes, sorry. Excuse me, Ms. Terry Ann. I just want to say something.
Sorry, who is this I'm speaking with?
This is the daughter, the owner of the company.
Okay.
I do not condone any form of social media bashing or anything like that. I don't even like any publicity. However, the issue right at hand seems to be whatever Terry Ann and Dorothy have against each other. This time that Terry Ann was there last was for 2 days to cover. This entire incident that's being spoken about was just a matter of covering. And one thing I did ask was that she not leave the patient by themselves, just like I would tell anyone else. I have a group chat with all of the staff, and that was one thing I mentioned. Taking Dorothy as a client out of the picture.
Because she's your mother and you own the company.
Yes, but she's a client. She is a client. She pays what she needs to pay. And that is one thing I ask is for her to be respected as a client versus being respected as my mother. Separately, I don't know, like I said, I didn't hear everything, but I was also told that her hours have been cut and this and that and that and this. I have provided Terry Ann with the opportunity of having a job on a daily basis. I have messages where she refused to go anywhere other than my house and my father's house. I have tried even up to yesterday, today, and tomorrow. She has work lined up. She told me she's sick. That is fine. I said, if you are unable to go anywhere else outside of my house and my father's house, I'm going to need a written letter from the doctor because that's not enough for you to do for a whole week, every week. It's absurd. That's all I asked. That's impossible to do. I have helped Ms. Terry Ann outside of giving her hours where I do not work. I've done all of these things and I have proof of all of that.
So when she, let me just ask you a question. When she took the job, was the understanding that she would be going to different locations all the time, maybe even daily? Was that fully understood?
It was a caregiving job. And then it didn't work out with that client. So I basically took her on at my house. I have a son that's not even.
Terry Ann, just a second. Let her finish. Terry Ann, let her finish.
This is the problem. And even when the police got involved, it's the same thing. It's always a back and forth. I genuinely cannot. I don't have the patience for it. So I just leave it alone. I like proof. So I do all of my things in WhatsApp messages and all of that is there. I've even provided informal, and I said it, an informal warning because of the fact that hours aren't respected. If I say, I need you here, I need you there, I need you there, it's almost as if she just goes where she pleases. And some days she doesn't come to my house and I do ask. She's a caregiver. I've set her aside with other clients. The clients have complained. So I have to find place for you. I didn't let her go. I could have said, okay, I don't have, I can't give you any more work because no one wants to deal with you. She's there 2 days and I have a written complaint about her. But I've never ever said that to her because I have continued to try. I've never brought that up because I continue to try with her, and that is why I took her into my home, my personal home. I didn't need to do that. I'm literally paying her to do nothing at this point because it's a 1-bedroom. I make a mess in order for her to have something to do. I could have said, listen, I am trying, and I have tried. Every time I ask her to go somewhere, it's impossible to do. She could have had a caregiving job sitting in for someone for 3 days. She told me she can't do it. However, she's on Cayman Road speaking about it. I don't know. I don't know.
I was just waiting until it goes through to tell you that.
Terry Ann, that is completely fine because your work permit was deferred. Your work permit was deferred and it was deferred meeting. Terry Ann, me and you always have a back and forth and you never listen.
All right, Terry Ann,
don't
just listen.
give people the time to listen, and that is the biggest problem. And I've said that to you many times.
Not what I'm saying, Of
course, I'm not hearing what you're saying because I was speaking. Well, then communicate that. Why are you online saying that you've done this? I have been nothing but good to you, and I've communicated every step of the way.
I decided to call their name because I am here to try and get my passport back.
But Terry Ann, I tried to help, and Sandra, that's another thing. I have assisted.
Terry Ann, just hold on because I can't hear you both at the same time.
I have assisted Terry Ann in getting her passport back. The one thing I told Terry Ann not to do, I said, do not go. Terry Ann, you spoke to the police on the phone together, and I tried to get it back. And what the man was saying is that she was at high. What was it? She's at flight risk or something. I don't even know what that means. He said that she's at flight risk. But he said that her bail was $2,500. I said, how the hell is someone's bail $2,500? I think that to me, that is a serious thing. So I looked into it and I said, okay, well, what is it? He then told me that it's some assault charge, whatever. And I said, okay. Then it went from 2,000 to 5,000. That's not normal.
That's a lie.
That's not no. Terry Ann, he was on the phone with me and you.
10,000, I tell you. From 2,000.
Okay, well, that's even worse. That isn't worse.
But how can he give you? No. But the whole thing doesn't make any sense because how can he give you a bail amount if she's not even gone to court yet?
Thank you very much. Because
that part doesn't make any sense. Like something fishy going on with the police for sure.
I have no idea what is going on.
Because that's not how bail amounts work. I mean, they put you. They put you. They arrest you on suspicion, and she's not even been charged yet. So,
and what they're saying is that she's flight risk. I don't know what that means.
Flight risk when you haven't even been charged.
Miss Sandra,
that's why they took the passport away.
They have people who are in murder who they don't even take passports for. So I don't really understand this.
When I asked for the information from the police that night and she was on the phone, he didn't want to give me any information. And I said, okay, well, I said, how is it that I said, all we for that instance, all we needed was a copy of her passport to get her bank account sorted because they refused to give it away. And I said, okay, well, what is it that she would need to get her passport back? And they said that she was flight risk and that it went from 2,500 to some 5,000, and then she came back and she said it was 10,000. And I said, why?
Yeah, just wait. You can explain, but just wait, because what I'm going to do is I'm going to go ahead and have Miss Dorothy and her daughter come off, and then you can explain all you want. But I mean, there just sounds like there's a lot of mix up here for sure.
Miscommunication. If you ask me, it's miscommunication. Like I said, I've tried to help. I mean, I've paid outside of what she should have gotten. You know what I mean? If you're going to stick to the contract, I've paid outside of what she. Jesus.
All right, Miss Terry-Ann, hold on. All right. So is there anything else that you want to say, young lady, before we let you go?
I just don't like, the things that are being said, to be very honest. And like I said, the whole banter just now sounds like a very personal thing. And at the end of the day, yes, that's my mother, but she's also a client. And she's not the only client that has had a problem. Right now, I'm in the middle of trying to get, everybody to be evaluated. I do my things correctly. I don't like the bandulu foolishness. I don't like running a potty shop. That's not me. That is not me. I could have let go of Miss Terry-Ann a long time ago. Like, I chose not to because I tried to help her as much as possible. I met her son during Christmas. That's something I didn't want to do. I completely understand that I'm a single mother of a son. Like, I don't.
Just a quick question.
Hold on, Terry-Ann.
Ask me how was my son.
Just hold on a second. All right. So, if that, just hold on. If that's all you have to say, that's fine. I appreciate the phone call.
No, all right. Yeah, I just had to clear that up. So, okay. I would like to know publicly. So is the work permit canceled? Because I had, like I said, I had no idea.
Well, she said she went and canceled, and her sister also passed away this morning as well. So I'm sure she's
I didn't
feeling
know that.
Yeah, I'm sure she's feeling
which I can understand, and
emotional.
I am compassionate.
Yes,
I absolutely understand that, but I think you should communicate it to me. She just told me this morning that she couldn't come because she was sick.
You told me that it would not be processed until today, so I'm waiting.
But Terry-Ann, you told me that you were sick yesterday, and you told me that you were sick today. That is what I'm trying to say.
And that's why I cannot understand
and that is fine. But what I'm trying to say is communicate it. And all I'm trying to say is communicate it.
No, Miss Sandra, don't say that because I'm tired to try to communicate with you. I'm tired.
Terry-Ann, you ignore the messages.
Adriana,
so
one thing I have to say, you should have listened to me a long time and got rid of Terry-Ann. That's what I have to say publicly, privately, and to Terry-Ann. You should have gotten rid of her all the time because she's just bad news. That's what I have to say, and I have nothing more else to say.
All right. Thanks, ladies.
Thank you.
Okay, dear. All right. Well, I wasn't expecting anybody else to call in, Terry-Ann, because you certainly didn't call any names, but I guess they knew that you were talking about them. So you've sent us a picture here of the dining room in question that you're not permitted to sit at. And then
I used to sit at the table you look, not the one that you look immediately at, the one to the door.
There's another one to the door?
No, all right.
The one with the red tablecloth, that's where you can't sit.
Right.
Okay.
The table, I'm not allowed to sit at.
Okay. And then this area now, this is where you said you were sitting outside with the dog.
Right. So look how close the dog and that dog tied there. Right? So if a dog tied there, what do you expect the dog is going to do all day?
So nobody's walking him is what you're saying, and he's using the bathroom right there.
No. Right. So nobody isn't there to walk him or anything like that. So why would I leave my home? My mother is not living far from me in Jamaica, right? And my mom know that she cannot send food in no cover dish like that. Can't give me, because guess what? My area right there, Miss Sandra, the dogs, I don't have one, but the people dogs just come and litter that walkway, right? And once that food passed that walkway, I cannot eat it. If I eat it, I come from this family who my stomach is very easy to get upset, right? So I took my lunch hour
So this
and I
little
leave the
table here next to
compound.
the dog, that's where you were permitted to sit in the sun and eat your lunch.
Right. It's not in the sun. Honestly, I'm not gonna lie. It wouldn't be in the sun because it's shaded by the shed, if you can see it. Right? So Miss Andrea came on just now and said that she lost clients. How is it you lost client and just since week you're asking me to go back to the same clients? Right? If you lost the clients, how are you saying I was not permitted to go back there? All these people she's telling you about, she lost clients, that's a lie. I have spoken to each and every one of these persons. The person who is in charge of them, I still get in touch with them just to say, hi, how are you doing? And I would get a response. See what I'm saying? So that's a lie right there. Right? Miss Darcy is saying, oh, I'm a problematic. When I went to these people's house, they're not bad people. I think they just get overwhelmed with the fact their mom is going through such a stage in her life. So I'm not sure. I'm trying to see if this is the video. So I'm saying those people, they didn't do nothing too wrong, because if they find out, oh, they don't want to use me anymore, that's on them, right? Because the mom is very tedious to work with. She's very, like, I understand her because I love elderly people. I have been working alongside elderly people. I am not certified. So I can understand if Miss Andrea have me doing just cleaning, but you employ me as a caregiver, care assistant, caregiver, right? And this little work, the only thing the work requires, Miss Sandra, you to be there, clean the lady room, clean her bathroom, clean her area that she be in most of the time.
Sounds like the connection was dropping out
Should be a
there.
little veranda.
Yeah, the connection was sort of dropping. But you know, what do you say to the criticism that she says that you only wanted to go to one or two like her parents' house, basically?
Pardon?
Where she said that you only wanted to go, like, you know, she's assigning you to go to other places.
I'm not hearing you.
No, when she was saying that she was assigning you to go to, yeah, can you hear me? Yeah, I don't know if you're walking around, but the connection started to drop out a little bit.
I'm hearing Sandra.
Yeah, can you hear me?
There was an inter.
Yeah, the connection seems to be dropping out a little bit. Hello? 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 Okay, hold on one second. I think we have. Yes. Hello?
Yes.
Uh-oh. Oh, shoot. That was my fault that time. Hold on. Let me see if I can get her back. I couldn't really hear her earlier. Yes. Yes. Hello?
Yes, ma'am.
Yeah. So, no, I said, how do you respond to her
and,
criticism that she was assigning you to go places and then you didn't want to go?
That's a lie. The only time I refused to go was from week, because this is the case, Miss Sandra. I have always communicated with Andrea. I stated to her several times, to get to her, Miss Sandra, it's not easy. I have been molested begging people ride. Over and over again, I have been molested. Saturday, I begged ride to town from where I live, and Saturday, I was molested because of begging ride. This guy feeling my private area. I don't know this man from Adams. So, what
You
I'm
mean
trying
when
to get
people
at,
pick
Miss
you up to
Sandra,
give you a ride, they're molesting you?
right. So I am saying to
Another
get
reason
to
why we need
Newlands,
good public transport system.
but if you know anything about Newlands, right? You know there is only one bus from town in the morning that goes through the bypass up there. So I am saying to her over and over again, I said to Miss Andrea, you cannot ask me to go to your house 11 o'clock in the midday right there because it is very tedious for me to get a ride up. Oh, Miss Tarian, I don't know. You have to figure it out because we're only responsible for you 10 o'clock at night. Right? So I am to go give care for this week at Mr. Gale in Prospect, right? And then I must leave, I will do from 9 to 1 there. Then I must leave from there and find myself at Newlands at her apartment. And this is the main reason why I drop her permit. Because if I'm telling you over and over, Miss Sandra, take into consideration. Take this into consideration because you're putting me at risk. You're putting me at risk to be molested every time I have to beg ride because there's no bus that runs there. It's not like I'm going to stand there and wait until a bus comes. No bus run in that area. So when you do it like this, what are you telling me? Right? And it's not the first you send me down there. It's not the first you say I'm to go there. And I tell you, I explain to you. Right? Every single thing they're saying, that is not true. Miss Darty went to somebody's house and saw them telling the worker to eat out on their balcony. And she come back home want to behave like she's like that person. Hence the reason why I was asked to go around the back. Right? And she's telling me that, oh, I went there and the lady told the girl to eat out. It's a balcony and I can see myself eating on your balcony because that would be nice, look out and eat. No problem. Right? But why am I to be stooped so low you want me to sit with your dog? And because I decided on taking my lunch hour and leave your compound, you're now going to want to ridicule me. You're going to want to curse me from here to there. It's have nothing to do with my work.
So someone else says that, they're responsible for getting themselves to and from work. And so, they don't get any special consideration from their employer.
I don't mind taking myself to and from work. She asked me to go to West Bay, which is $8 from where I am living. And I went for the week without word. I didn't have a problem going because it's a bus route. So I stand out my gate, I took a bus, I go town, I took another bus, I went to my work, I come back on a bus, I come home on a bus. You see what I'm saying?
Did you report when the gentleman was touching you and your privates in the vehicle? Did you report that to the police?
No, ma'am, because this is something like it's an everyday thing. And can you think about if I'm that chatterbox who will stand up for myself because I did tell him to stop and fling him hand off. But at the end of the day, Miss Sandra, can you imagine those people who is not speaking up?
Yes, well. All right, so we have a video here, which you're also sharing. We're going to go ahead and play the video, and then you can tell us what this video is. Just 1 second. So we have it here. So this is the video now. You going into the house?
Yes, ma'am.
And I think you're playing something in the background, so if you could turn that down for me.
It made me so disappointed that it's unbelievable. Very, very disappointed. I am really sorry that I even recommended you to come to this job. Very sorry. Because I have never ever met so controversial and act like you never, out of the 80-something caregivers, 100 and something caregivers that we have, you're the only one that act like this. You decide to do what you want to do. Every other caregiver come here from how many years? 2000, and they sit there, they're you too special that you can't have your own care or do whatever. We went to a place yesterday, I took a caregiver to another place yesterday, the woman, the first thing the people told her, this is our private space, and you can have your breakfast or lunch or out on the patio, and so forth. You are too special to go out there. So what happened if you went to those people's place? Or because they're the white and we're black. Okay. We come from a family that had a lot of money. And I don't act like you. Neither do my children. So I don't know which prominent family you come from or where you come from in Jamaica. Where you act like this, because I know in Jamaica you wouldn't act like this. All you're going to do is really affect yourself with ever getting another job in Cayman or staying in this island with your behavior. You need to go back to your farming where your plants don't talk back.
All right, so this is the video then that you say that as you come in the morning, Miss Dorothy's going on about where you eat. So was the discussion, I'm wondering why this would be the first thing that she'd be saying. Was the discussion the day before about where you were sitting, and or you came in that morning and you were trying to eat breakfast? Like, how did this kick up as soon as you walked in?
Miss, as I said to you, you hear when that door open? That's me just putting down my bag. She don't want me to walk at her front door. She said I have to walk at the back. Even when the rain is fall and the grass is tall, I wear one of those shoes to wear that, if they get wet, it's soak, right? Kind of cloth top. And I have to take my shoes off one morning and walk in that tall grass around to the back. I have video of that as well. But I am saying, how do you treat a big gray woman like that? I just walk in your house and nothing. I haven't done nothing, and you start cursing at me, and this is like a everyday annoyance. And if you notice, there's nothing there saying I am not doing my own.
Hi, morning.
Sandra.
Hi.
I am a supervisor in the company that this person is speaking about, and I don't understand why she should be saying so much lies about exactly what is happening, and for some reason.
But how can you say she's lying if that's been her experience? I mean, she's showing us videos and pictures, so she's talking about her own experience. If you haven't experienced that, then you can't say it's a lie. All you can say is you haven't experienced it.
Well, I do have an experience there. All right. And based on some of the circumstances, that are at the house, you would understand why Miss Dorothy asks us to do certain stuff.
Okay.
Most of this.
So why do you go through the back door?
Number one, her husband is sickly most mornings. He will sleep late.
Okay.
So normally, if you go to the front door, as you go through, he normally wake up. Understand? She always asks
So
us.
his room is by the front door.
Yes. So she normally asks us to just walk at the back gate and go through the back, and then we enter. I had no issues with that.
Okay. And where were you permitted to eat?
I normally eat outside under the what do you call
right where
there?
the dog is, by that table.
Yes.
Okay.
So
and I mean, were you ever bitten by mosquitoes?
No, not at not at all. As a matter of fact, I don't remember having a mosquito ever. I don't remember actually seeing a mosquito there since I've been there.
Okay.
My experience, as you said, may be different from her because I have a love for dogs. So when I go there, I don't mind if Gucci sits down under his fan and enjoy himself while
Well, I mean,
I'm just
I have
there
a love
chilling.
for dogs too, but is Gucci using the bathroom in that same place, or is he being walked?
No, he doesn't. He doesn't use the bathroom on there. He doesn't. He normally goes out in the lawn and does what he does. And then in the mornings before we arrive, Mr. Arthur will go outside and she'll clean up the mess before we get there. That's what I do know. As for our shoes inside the house, Mr. Arthur's husbands have a sickness where it does, and it sort of does affects him. So she kind of asks
well,
us,
I don't wear shoes inside my house either. But
exactly.
I mean, I provided Miss Stacy with house slippers, so when she comes, she can have house slippers to put on that only wore inside the house, because that's what I do. If people come to my house, they'll always see me wearing slippers, quote, shoes inside, but that's not shoes that I wear outside the house. They're indoor shoes only.
Okay, and Miss Sandra, this is something that we also need to understand. Clients are paying for a particular service. All right. So if a client says that they don't want you to sit at their table, that's what they want. You cannot argue with them and tell them that, okay, they're paying for that. And we have to respect that. You understand?
And then she said, listen, fine. She doesn't have to sit at the table, but then she would just leave the premise and have her lunch. And then that became a problem as well.
Yes, because, all right.
But you can leave for your lunch if you want. I mean, I don't know.
Well, not every patient you can leave, because how.
But not every patient. She didn't say every patient, but she said no. But she said in this particular case, she would go to the daughter's house and sit down because, she didn't want to sit outside next to the dog in his mess.
Yes, and that is something that was, I'm not sure, but it probably was discussed with her that you're not supposed to leave off that premises. Anything can happen to that patient during that time that you're not there. And then the company will be liable for that. I've been working at that location for months, and I've never left to go by my boss's house because you might not know what happened during that time.
All right.
Pardon me?
Just a second. Let her finish, and then we'll continue. We have some other callers. All right, Miss Supervisor. Thank you.
Yes. Okay.
All right, dear. Thanks very much. All right. We've got another caller. Good morning, caller.
Good morning, Sandra.
Hi. Morning, dear. How are you?
Morning. I am listening to this whole matter, and I have to tell you, if this was a matter in court and I was the judge or the jury, I would have ruled in favor of the first lady that called you. But what I would like to say to all of this is that I have never, ever, and would never, ever ask anyone that has worked in my house to go and sit outside, eat, much less sit with the dog. Okay? First of all, I would consider that you're being very inhumane to that person. Anyone that has worked for me can tell you that even if they wanted to go outside, and I have a screen back porch and everything where they could sit, I said, you can sit at the counter, that's their choice.
Sorry. I was not doing anything. My phone cut out. What did you say, ma'am?
Just a second.
But the point that I want to make is you don't treat people like, I wanted to also add, was people might love dogs and stuff. You also have to bear in mind there are people who are terrified of dogs, whether the dog is aggressive or not. You have to bear that in mind. And I will say this, there is no one that could tell me coming through their back door or go and eat with the dogs that I would return to that job. And then especially when my greeting in the morning is not good morning, we need to have a meeting, but to say to me what was being said to that lady. On the matter of her passport, it sounds to me like she was arrested but given police bail. And with the condition that she cannot leave the jurisdiction and she must stay away from all ports. That's what it sounds like to me.
Yes, that is it.
Nobody could go back to the police now trying to negotiate with them, and the police gave her a price. That would be illegal, okay?
Yeah, that sounds very strange.
No,
I haven't heard that
so
before.
let me please explain what they said. Let me please explain what
Just
they
wait
said.
till Miss Brenda's done. Yeah,
Just
just wait till Miss Brenda's done, then you can respond to that.
If they would put if a figure was put on it, that would have to mean that the matter went before a judge, and then the judge is saying, okay, you have to post bail of X amount of dollars. So something is very wrong with that story. And just listening to this whole thing, and I'm a very good judge of character and truth. This lady needs help.
Yeah.
If she is telling the truth about her sister passing, that her son is there with no one, she needs someone to step in and assist her, whether she has to pay a bail bond or whatever. But at the very least, she should be able to
And I've already, while we've been speaking here this morning, I've already reached out to the Jamaican consulate because I'm hoping that they can offer some assistance as well as the RCIPS.
Because she is a Jamaican national.
Yes.
And furthermore, whoever's holding her work permit, in case they don't know it, they are responsible for her. Okay? That's what the law says. And it sounds to me, and I'm not taking, let me rephrase that. I am not putting down anyone. But I think too many times people get into businesses and they don't understand how to run a business. They don't have a clue of the labor law or the immigration laws. And then you think, oh, they're Jamaican or they're from wherever. They're nothing, we can treat them like this. And then you bring them here and you're very condescending and demeaning to them. I don't cut that BS. I don't treat anyone like that. And I don't care where I go. If I come to your house, Sandra, and I hear you speaking to your helper like that, I'm sorry to tell you, me and you can get into it. While people might look at me and got their opinions of me, of what I am and what I am not, ask anyone that has worked in my house or in my yard if I have ever treated them like that. I mean, just yesterday, I had my gardeners there cutting down trees for me. And I always offer them water, something to drink or whatever. Normally they bring their own water, but I offer to them. I was out there working with them, okay? That's how I treat people, because I wouldn't treat you any different than I would want to be treated. And it doesn't matter what our job is. We don't want anyone talking down to us. That is what we are now complaining about. The unfairness. So if we don't want it, the best example for us is not to shove it out on other people. If I have someone who's working for me and it's not working out, because I deal with the agencies, I just ask for someone else. I am not rude to them. Like I said, I try to give them as many chances as I can, but I would never be rude or disrespectful. So you can ask any of the agencies that I have dealt with, because I deal with the agencies. And this has upset me, because I don't like seeing people treated like this. Now this woman is in grief. I'm assuming she's telling the truth about her sister, so we don't know if that's her fault, but she's now in grief. And then added to this with an allegation of wounding charges against her. I don't know if there's anyone else that can assist her with her son. I mean, come on, they're human beings. Let us treat people like human beings. Anyway, that's all I wanted to say.
Yes.
And the woman does need some assistance. You know, and even if they allow her to go home conditionally, but return if she's charged and so on. And that can be done through the Jamaica police.
Yes. Thank you. Thank you, Ms. Brenda.
All right. Okay.
All right. And we do have some other folks who were calling in as well, but go ahead.
A minute before she go, let me tell her what the police says to me was that when I asked them, because remember I'm saying my boss first wanted me to get the passport so she can get me a bank account. Why I went in December to try and get it with a Caymanian, because that's what I was told. Now, on that day, they told me that I would have to pay $2,000 with the Caymanian to sign. And I'm saying, what? Let it stay and I leave. So in February, when my sister told me that she is ill again, and I went to get a copy of the passport because my boss again said she wanted to do the bank account. She need a copy. So I went on the 17th to get the copy. And I asked them again, how can I get my go home if there's an emergency, knowing what my sister is going through? So they said to me that I would have to pay $10,000 until I come back. So the $2,000 would be like a security, right?
No, sir.
So I'm saying they're saying that it is a $5,000 fine. So I'm saying I must look like I'm stupid in front of these people. How can it be $5,000 the total, and then you're gonna say I have to pay double time that for me to go see my sister and come back? So I just leave it be, right? And just wishing and hoping that yesterday when I went back to court to them now, they will give me my release letter based on the fact that the evidence are clear. Because the evidence is clearly showing that this man getting finger cut from somewhere else, hurt it up on that door jam where you can see that little bloody water run down, not fresh cut, right? And you hold my passport because it is your law to hold it. You don't see the evidence there and release my passport so I can go.
And I mean, the thing about this is the DPP could just make a decision whether or not they're going to charge you and take this to court. It's not a complicated case, I mean, let's be clear here. They could wrap this up. All right. Quite a few people asking to please give Miss Brenda kaboom. Davian says, Miss Brenda, you are heaven sent. Rohan says kaboom for Miss Brenda. And Damien, another Damien, there's a Davian and a Damien. Damien says it's called compassionate leave. Many have no people or leadership skills. Thank you, Ms. Brenda, says Irvelin. Miss Janet Lawrence, thank you, Miss Janet, joining us from Tampa, listening in. And she says, give Brenda a kaboom. Candy also says, give Brenda kaboom. Robbie says, well spoken, Miss Brenda. So, I mean, there is something to be said for Miss Brenda's points. And even Miss Dorothy here says, I agree with you. However, you don't know the whole story about the situation. But I do think that it's important that we're mindful of how we talk to people, because there are a lot of Caymanians and other people who really believe in talking down to the help. Somebody said this whole show is reminding him of that movie, The Help, where, back in the day, they were treating the help like slaves because they still saw Black people as slaves, and they would treat them less than, but still expecting them to raise their children and to wipe the behinds of their elderly and all this sort of thing. So I think that respect is due. Obviously, people can lose their tempers, and I suppose people might have their moments. But she's saying that she was having to put up with what she saw as quite a bit of disrespect. Miss Dorothy, I think, to be fair to Miss Terry Ann, the way in which she's being spoken to in this video doesn't reflect an environment that any of us would want to be working in, especially when you've just walked through the door. So I guess the issue is because she came through the front door and not the back door.
If that was the back door, I went to Miss Andrew. She was in the kitchen area. And
so this was the back door that day.
Yeah. Oh God. I went right beside that table. That was the back door.
And so, folks, in my mind, the thing to do here, instead of talking at her, is to maybe sit down and have a conversation with her to say, let's go over the house rules again, instead of taking this approach.
I mean, you have made me so
Sandra,
disappointed
I
with
have
this
been
whole thing.
looking at
Just
that
let
for this
people, because some
month.
people haven't heard the video, so just let them hear it again.
I am really sorry that I even recommended you to come to this job. Very sorry. Because I have never ever met a so controversial and act like you. Never out of the 80 something caregivers, 100 and something caregivers that we have, you're the only one that act like this. You decide to do what you want to do. Every other caregiver come here from how many years? 2000, and they sit there, they're you too special that you can't have your own care or do whatever. We went to a place yesterday, I took a caregiver to another place yesterday, the woman, the first thing the people told her, this is our private space, and you can have your breakfast or lunch or out on the patio, and so forth. You are too special to go out there. So what happened if you went to those people's place? Or because they're the white and we're black. Okay. We come from a family that had a lot of money. And I don't act like you. Neither do my children. So I don't know which prominent family you come from or where you come from in Jamaica. Where you act like this, because I know in Jamaica you wouldn't act like this. All you're gonna do is really affect yourself with ever getting another job in Cayman or staying in this island with your behavior.
Caller, good morning.
Morning, this is me again. I said that. Now I wonder why whether she record. I am not going to dispute I say that because I was angry and this woman has done all it. I'm not going to record her. I support caregivers. And the caregivers that are calling me right now saying they can't believe, I support caregivers. Because we use an agency, you have different people coming in and out of your house, right? This woman was only here for a few days or whatever. The thing is, we leave our back door. I don't want to hear what she has to say right now. We leave our back door open for every caregiver to come through because it's safer to leave the back door open than the front door. Because the front door end about a bicycle off of the front porch. So we leave that closed. You come through the side door. The only time we don't leave the side if it's raining, right? However,
Sandra,
the fact is that
just a
you're going
second,
to
Terry Ann,
record
just a second.
our personal house or personal space to put on social media is ridiculous.
Are
You're
you
going to
hearing me,
record.
Sandra?
Yes, just hold on, Terry Ann. I'm hearing you, but just hold on.
Why would she record her personal place? I don't care if she record me or whatever. What I said is what I said. And I agree with everybody. Now, about compassionate leave, right? Up to delivering flowers and things I have delivered for this woman, for my daughter, because her caregivers, giving them little things. When there was training, Terry Ann never showed up for the training. Every time she had training, she never showed up. I am not here to dispute anything that anyone said because, okay, like what you said, in the heat of the moment, you're angry about things and it happens, right? We're human beings. Okay, maybe I shouldn't have spoken to her like that. She shouldn't have recorded what I said. She shouldn't record her personal space. Why would you record our house or space and put it on social media?
Well, I mean, she hasn't put it on social media. She sent it to us, but she's sending it to us to prove that what she is saying is accurate, because obviously you have one version. No, you have one version of the story and she has another version. So,
okay,
you know, like she said, she likes to have her evidence. So that's
that's perfect.
She's just showing, she's just showing it to us here to say, you know, here's an example. All right, Miss Dorothy, thank you, my dear.
Okay.
All right, dear. So, I mean, you know, a lot of people know that they have to have their evidence when it comes to, as they say, mouth can say anything, but having the proof is a very different situation. And she doesn't have the proof of this man. Let me show you guys what they have her arrested for and refusing to give her passport back. This is actually, again, in my humble opinion, utterly ridiculous. This Jamaican man who wanted to continue to have a physical relationship with her, and she said no. after twice, I guess he wasn't doing the job or whatever to her satisfaction. So she said she didn't want to do that anymore. This is a little cut that he has on his finger. And this is what they charged her with, why they've taken her passport and won't allow her to get it back to leave the jurisdiction, and telling her she has to come up with $10,000. I've known of people who've done way more than this and they didn't have to come up with no $10,000. I mean, it's just crazy. So there's a little cut in his thumb from the door that he is claiming. This might not even lead to a charge.
No, ma'am. No, ma'am. That's not from the door. The door did not close any at all. And if you look on it, it's inside the inside of the thumb.
So
right?
what is this from?
If you, I don't know where he got the cut from. Look on the door jam where
But
he
he's
jammed that
claiming
finger.
it was from the door.
Right.
Yeah.
So the door did not close any at all. Like I said, if you look on the door jam that I sent you, he jammed that hand on the door jam, which hurted the finger up. So the bloody water run onto the jam, right? Then he grabbed the knob, the door knob with the right hand. So he stepped right in between the door and the jam, so the door could not close. So the door didn't close any at all. Then he sent his hand right under my neck, grabbed me, shoved me right to the floor. So I get up. I did not retaliate because he said he's a woman beater and he's going to F me up. So I get up and I call the police.
So
When
you're
I
the
tried
one who
telling
called the
them-
police and then they arrest you.
Exactly.
What a mess.
And now I put my case against him and I decided to leave it alone because I'm afraid that when I go to court, if last year, they're going to arrest me again instead of him, because I was told that I did not touch him any at all and I arrested, and my case that he touched me is non-arrestable.
Oh my gosh. Okay. Very, very sad situation. I saw you sent another video here, but I'm having some problems actually downloading that one. But that's in relation to the guy, the police officer. Who were the police officers? They were Jamaican officers that showed up at the scene?
I don't even know. I was out of it to know who they were at the time. Honestly.
Okay. What a mess.
Oh, that video is just to show you it's a foot of socks because I'm afraid of blood as well, So when he grabbed my neck, there was a few.
We see a name on one of the officers. I can't quite make out his name tag. But
that's supposed to be Detective Connor at the time.
That was Detective Connor.
At the time, and his was it? I think it was him.
Well, my dear, I think the what's in your best interest now is probably to just get your passport and try to find your way home to deal with your situation there. So
that's what I call you about mainly.
All right, so I'm gonna somebody said this is giving 12 years a slave, that movie, not even The Help. This is worse than that, is what they're saying. So let's see what we can do, folks, in terms of trying to get you home. We had one more caller who I know was trying to call in. We'll do this as the final call before we go ahead and end the program today. But such a sad state of affairs, because I think the truth of the matter is there's a lot of things that this lady has touched on, even the sexual abuse from, being picked up or even within homes. Those are things that people are having to deal with every single day here in this country, the abuses that are happening.
I want to say something before you end the program.
Yes. Go ahead.
Go ahead now.
Yes.
So I want to
Can
say
you please
the only
leave a
person
message,
who
please?
treats me, the only person who treats me like a human being from this lady's family, from my boss family, was her family.
Was who? Sorry,
her dad.
Okay.
I work with her sister. And her niece. Her niece isn't bad either. Her niece and her dad. But her sister and her mom, they treat me like crap mostly. I took my day off. Remember, I do not work. If it was like a caregiving job, then you'd expect to work whenever the call come in, right? But here it is, on a Saturday, I was not working, and my boss called me and said, would you like to go do some cleaning? And I said, sure, because, money cannot too much in your pocket. And here it is, I went to that location to did some terrible cleaning there. Even give up my lunch hour, right? And this lady arguing with me, telling me that when it reached 5 o'clock and I'm ready to leave, I must work, I must clean behind these places and stuff like that. If I think she's paying for that and a bag of stuff, right? I'm like, seriously? I didn't even have to leave my house because it's not like when I do those little overtime that my paycheck is gonna go up.
All right, one more call. Good morning, caller.
Good morning, Sandra. This is rough. When I tell people things, they think that you're telling lies. But you hear what a girl say. She called the police and they arrest her. I had a similar case. Say them police not ready. And they never arrest me, but listen to this. The person came at me down by the farm and insult me and tell me all kind of dirt. And it's one of the piss of tail for that even younger than my son. And I had witnessed all the people on the farm and everything. And I never called no police on him, but he gonna call police on me now and report it the next day. And the police come to my yard telling me blah, 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 blah. And I explained the situation to them. I say, I have witnessed this little piss of tail had no rights. I say, I've been up in him before he born. And he come out and sent me a new son. I'm not going to no further on that. But anyway, listen, now. They gonna tell me what is it. I said they're liars because he come down and say one story and then you come in with a different story that he said. So what is the right story? But then they gonna tell me, well, they not arrest me, but they were warning me. So you see, when I tell you that these things go on, you hear what a girl just said.
Yeah.
And what I'm saying, if his finger was jammed in that door to cut it or bust it, it should be bruised because it had to be hit with force. If it just got a little cut, it was not from that door. Quick sense of nonsense, but they say common sense, not so common no more. But you see, when I say something, they think that I talk because I got mouth and tongue and breath. And I be telling that you hear what a girl say, and plenty of time them situation happen. People come at you and you get arrested. So now I tell you, you got to take your own revenge and then you be arrested for something, not for being innocent.
Yes, my dear. What a mess. Thank you so much.
That can only go on around here.
Yeah.
Nowhere else.
It's a mess. Thank you so much. We have some Instagram comments. CC Baby says, no excuse to treat anyone this way and pass those remarks. If you said it in person, you shouldn't be ashamed that it was posted publicly if you knew it was okay in private. Tashi British says, you said that the back door is safer to leave open, but your supervisor called and said it's because your husband is sleeping. You guys need to communicate better with the lie. Somebody else said if the front door has a doorbell or something on it, why is it that, that is an issue coming through the front door? So I'm not sure if there's some kind of bell or something on it. Linda says they have no power authority to hold on to her passport. Sorry?
All of that about coming through front door is lie, because when I go there and that man's door is closed, you go through that front door and you go inside and do what you're doing and get out. It is just, I'm telling you, I did 4 months with her from August. She wasn't here in August. I went to the house. I did a deep clean there, right? And then I was assigned to the husband. And I treated Miss Darty as if she's my own mom, because the man does not, her husband does not require no caregiving like that. It's not a sick person. You just need to be there with him. So I would go in, I would take the dog out put him outside where they put him and feed him. I would water the plants. I would, whatever towels to fold, whatever, house to clean, whatever. Hence the reason why they start treating me like I'm a cleaner instead of a caregiver, right? because I try to do every little thing around the house just to make myself useful. Because I am employed to him, as his caregiver, right? So how then are you now treating me, telling me that, oh, you're not a caregiver, you need to clean if you are cleaning? And what you're doing in ceiling every day that I must be sweeping down the ceiling every day? You come in, you said, oh, your husband went out. You need his room to tidy up. I run in, I did a quick clean, right? Why would you want me now to be in there cleaning down ceiling and stuff like that? He's not allergic, right? He just had surgery and stuff like that, and you just need to be there in case of anything. This man, he didn't want me to drive him. He didn't want me to do nothing at all. Right?
All right, my dear. Well, let's see what we can do about getting you your passport. Sounds like you're either going to have to, just go back home, or if you can find another employer that you can get on with. But I think the most important thing is to get you your passport.
I wanted to go home a long time ago. I wanted to go.
All right. Well, let's see what we can do about getting you that passport.
And I don't have any money, and I would like to ask my boss to pay me what she owe me, please.
So you can buy your ticket.
And give me back my money for my pension.
Okay.
And I haven't been getting any pay slip from December, and I've been asking for it and stuff like that.
You haven't gotten a pay slip. So sounds like there are some labor related issues here. So young lady, I think your employer's name is Sandra also?
No, ma'am.
What's her name?
Miss Andriana.
Oh, Andriana. Oh, I thought you'd call her Sandra earlier, but anyway, all right. Yes. Okay. So Miss Adriana, see about getting her her pension details, her pay slips, and so on, settle up. And
no, the pay slip is not important anymore. Just get me the money she is to pay me so I can go, because I'm dead broke.
Right.
All I had left from last month after I tried to fill my son and pay my rent is $50.
Right.
People have been helping me along the way right now.
Yeah. Okay. All right, my dear. Terry Ann, good luck to you. I'll be in touch with you personally. Like I said, I'm going to try to reach out to the Jamaican consulate to see if they need to intervene in your half with the police to get you back your passport, because this is the type of case that I see people leaving on their own recognizances for, a little cut on the finger. My goodness, this is hardly a capital murder case that you need to be taking somebody's passport for. And I'm pretty sure if she was that white millionaire American guy who said, oh, he needs to go check on property in the States when he had all those gun charges, and they gave him back his passport and allowed him to leave. And then he absconded the jurisdiction and never came back and still got a slap on the wrist. I think that they can certainly give her passport back over a little finger cut. All right. So we'll reach out to the police as well and see what we can do in terms of getting you your passport back. All right, Ms. Terry Ann?
Okay.
All right, my dear. Thanks very much. Folks, that's all the time that we've got today. What a hot mess. I think that there are a lot of people in the Cayman Islands who are being mistreated at work. And I don't think that that's right. And we need to obviously address those concerns. And it's unfortunate when it's happening with someone who's actually in your home, who you're utilizing as a domestic worker. And I've seen it with my own two eyes. I've heard of a lot of horror stories, and I'm oftentimes shocked that this is permitted and allowed to happen, because it really should not be. But we'll continue to advocate for labor improvements and change on all fronts to improve the quality of life for Caymanians first and foremost, but for everyone, because we don't want people coming to our country and then treating them like slaves. That certainly isn't right either, or treating them less than human. Folks, tune in tomorrow morning, 7:30 a.m. I will see you then.
This is our home. These are our people. And the future we build together starts with leaders who care. Alric Lindsay has never stood on the sidelines. He's been in the heart of the community, working side by side with you. From financial reform to everyday issues that matter to families, Alric has always been part of the solution, not just promises but real progress. He fights for better opportunities, for economic fairness, for accountability, because Caymanians deserve more than words. We deserve results. In Georgetown South, Auric isn't just running for office. He's standing up for every voice that's gone unheard and every dream that's yet to be realized. Leadership with integrity. Commitment without compromise. A future that works for all of us. On Election Day, vote for the man already working for you. Vote Auric Lindsay for Georgetown South. For Cayman.
Hi, I'm Melrose Natasha Whitelock. Most of you will know me as Natasha. I have lived in the Red Bay area since I was 9 years old. I have raised my kids in this area. They all remain in this area. Over the years, we've realized that there's many things in our community which has been left undone, unchecked, simply ignored. This year, I've decided to put myself forward for you, my community, and my country, so that we can step up to the plate together and get our community and country back on track.
On April 30th, please vote for me, Whitelock, Melrose Natasha, and Team TCCP.
I am Sabrina Teresa Turner, and I am running to represent the electoral district of Prospect. I've made the conscious decision to run with the other candidates of the TCCP because we are built on a foundation of honesty, integrity, and community first. Once you elect me on April 30th, I will continue the works that we have already started. Sustainable stormwater management, tackling with the traffic on Shamrock Road, and bringing our community and its people together, knowing that we are our biggest and greatest asset. Vote for Sabrina Teresa Turner on April 30th.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.